Order, order. The clerk will now proceed to read the title of the private bill set down for today.
Royal Albert Hall Bill, Lords, second reading.
Second reading what day?
Tuesday the 13th of May, Mr Speaker.
Tuesday the 13th of May. Right. We now order, order. Will the member wishing to take their seats please come to the table?
I swear by Almighty God that I will be faithful and bear true allegiance to His Majesty King Charles, his heirs and successors, according to law. So help me God.
Sarah Pritchett.
Welcome to Parliament.
Thank you very much.
As we said, see you start with.
Right, we start with questions. Secretary of State for Health and Social Care. Jack Rankin.
Question number 1, Mr Speaker.
Minister.
Thank you, Mr Speaker. We expect all women to be shown the utmost care and respect when receiving maternity and neonatal care. This year's planning guidance requires ICBs and providers to deliver the key actions in this final year of NHS England's 3-year delivery plan. But from listening to the harrowing stories of bereaved and harmed families, it's clear we must do more. Secretary of State is urgently considering the significant action needed to ensure that all women and babies receive the care they deserve.
Jack Rankin.
Thank you, Mr Speaker. Last year's birth trauma inquiry report exposed that maternity services in this country are woefully underfunded. Now the Health Secretary intends to cut the budget for maternity improvements from 95 million to just 2 million. That equates to under £4 per child born in this country per year. What kind of change is that? What message does this send to mothers across this country, and does he plan to implement any of the birth trauma inquiry's report recommendations, many of which were committed to by the previous government?
Minister.
What did you do?
The honourable gentleman is not correct. Maternity funding is not ring-fenced in the same level. I think that's what he's referring to, but it's absolutely being committed to as far as ICB allocations, and local leaders will decide how best to allocate that money. And we will continue to work with Donna Ockenden and the families of previous incidents and make sure that the recommendations of her report and the maternity review is fully implemented.
Jen Craft.
Mr Speaker. As colleagues will be aware, one of the key consistencies across failings in maternity units is a failure to listen to women and to put their experiences and quite often their pain during childbirth at the heart of driving improvement. So what assurances can the Minister give that women's experiences and voices will be at the heart of any maternity improvement strategy that the government focuses on?
Minister.
She's absolutely right to highlight, and that's been found out in all the reviews that have been undertaken. It's completely unacceptable. That's why my honourable friend, the Right Honourable Friend, the Secretary of State, has continued to meet with families and hear those experiences to make sure that we learn from those, that we continue to support the implementation of those reviews, and crucially we make sure that women's voices are taken forward as part of our 10-year plan.
So, Secretary of State Ed
Thank you, Mr Speaker. I fear many will have found the Minister's answer to my honourable friend disappointing. He highlighted that the last government committed to the headline recommendation of the cross-party birth trauma inquiry led by the Honourable Member for Canterbury and by the former Member for Stafford, Theo Clark, who's recently written about her experiences in a book and in the Mail, calling for a national maternity improvement strategy. No equivalent commitment has been made by this government. So can we try again? And will the Minister commit without any equivocation to implementing the recommendation of the inquiry to produce a national maternity improvement strategy?
Minister.
To be clear to the Shadow Secretary of State, that my Right Honourable Friend, the Secretary of State, is continuing to look at all of those and consider how best to respond.
Right, we come to Liberal Democrat spokesperson Helen Morgan.
Thank you very much, Mr. Speaker. Too many families in Shropshire have suffered the agonising loss of losing a baby following the scandal at Shrewsbury and Telford Hospital Trust. And with the CQC rating 65% of trusts as inadequate or requiring improvement for maternity safety, and the taxpayer forking out a staggering £1.15 billion in compensation for maternity failings last year, can the Secretary of State or the Minister describe how she can reassure us that with the £100 million that was put aside particularly to deal with unsafe staffing, with it no longer being ring-fenced, can she assure us that those safe staffing levels will remain in our maternity wards?
Minister.
Well, I know this is an issue that the spokesperson for Liberal Democrats follows very closely in her own local community. We are absolutely committed, as I think she knows and understands, to making sure that the recommendations of the reviews are fully implemented as part of that 3-year plan. But can I just gently say to the Honourable Lady that her party has consistently opposed the extra £26 billion that this government raised to support the wider health service. Without that extra funding and the decisions that the Chancellor made, we would not be able to make the progress that we are now starting to see.
Jessica Turner.
Question number 2, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. And despite my best efforts, can I welcome the member for Runcorn and Helsby to her place? Being a member of Parliament is a privilege, and I know how special it is to sit on these benches, having been sent here by constituents, and regardless of political differences, wish her well personally. Mr. Speaker, with permission, I'd like to take questions 2 and 14 together. Mr. Speaker, as part of our 10-year plan for health, we want to deliver a real shift in the centre of gravity in the NHS so that people get more care closer to home, indeed in their home too. The NHS has much a neighbourhood health service as a national health service. We've already made progress in shifting care to the community, £889 million more in funding for GPs, agreeing the GP contract for the first time since the pandemic, and recruiting over 1,500 GPs onto the front line. Our 10-year plan will set out how we will continue to transform the NHS into a neighbourhood health service.
Thank you, Mr. Speaker. I'm deeply concerned about the quality of healthcare for people experiencing homelessness in my constituency, Bournemouth West. Health Bus, a local charity, is doing great work to get out into the community to treat people where they are and prevent them from getting into hospitals. But they are not getting the funding they need and have discovered serious discrepancies in the way the local ICB commissions services, particularly for health inequalities. So can the Secretary of State tell me how this government is prioritising health outcomes for people experiencing homelessness, and will he meet with me and Health Bus to discuss how we can support their important work?
Secretary of State.
Mr. Speaker, it was the founding mission of the NHS to always be there for people when they need it, so that whenever they fall ill, they never have to worry about the bill. And unfortunately, too many people in our country today experience that fear that Nye Bevan sought to eradicate, thanks to the disaster and the failures of 14 years of Conservative government. As my honourable friend would expect, tackling health inequalities for homeless people and other vulnerable groups is absolutely central to the values of this Labour government, and those values will be reflected in our 10-year plan for health, and I'd be delighted to hear further from her on what we can do to improve services in her area.
Your plan.
Thank you, Mr. Speaker. And I want to thank the Minister for his announcement this morning regarding GP services. And one way pressure is eased in our GP services is through organisations like Compassion in Action. It's a charity in my constituency that provides non-clinical whole-person care. So they receive GP referrals across Lee and align with the government's aim to shift care from hospitals to communities. So will the Minister join me in thanking the staff and founder Pam Gilligan and agree to come for a tour to see the facilities and to see firsthand the impact that they have?
Thank you, Mr. Speaker. I wholeheartedly join her in thanking Pam and everyone at Compassion in Action for the work that they do. I think at the heart of this government's approach to health is a recognition that government action is essential for improving health outcomes in our country, but government acting alone will not be sufficient. That's why working with the voluntary sector, working with employers, working with trade unions, community groups, and actually all of us as individual citizens is vital for tackling health inequalities and improving care in our country. And I'd be delighted to make sure that one of the team comes to visit as soon as we possibly can.
Stuart Anderson, welcome back.
Thank you, Mr. Speaker. Community hospitals can reduce pressure on major hospitals, especially in rural communities like mine. Will the Secretary of State lay out his plans of how he intends to support community hospitals in South Shropshire?
Well, Mr. Speaker, at the heart of this government's approach is investment and reform of the NHS to make sure we deliver better outcomes for patients. That means the biggest devolution of power in the history of the NHS, with more decisions taken closer to patients and their communities, indeed more power in the hands of patients too. Community hospitals do have a vital role to play, and no doubt, thanks to the decisions taken by this government to deliver £26 billion more into our NHS, we'll be able to make further and faster progress, opposed by the party opposite.
Susan Murray.
Thank you very much, Mr. Speaker. In my constituency of Mid Dumbartonshire, there's an ageing population in need of local healthcare services. Will the Secretary of State meet with their Scottish counterparts to discuss the need for increased access to community healthcare, specifically the need for a new health and care centre within my constituency of Mid Dumbartonshire? Thank you.
I'm grateful to the Honourable Member for her question. She'd be delighted to know that only last week I met with my counterparts in Scotland, Wales and Northern Ireland to talk about how we can work together to improve health and care throughout the United Kingdom of Great Britain and Northern Ireland. She will know that health is devolved, but thanks to the decisions taken by this Labour government, the Scottish Government has just been delivered the biggest financial settlement since devolution began, which might mean they might finally make some progress on their waiting list, where 1 in 6 Scots are on a waiting list, and the SNP are onto their 5th NHS reform plan in 4 years.
It's coming down. Alex Ballinger.
Question number 3, Mr. Speaker.
Minister.
Thank you very much, Mr. Speaker. I'm very pleased to tell my honourable friend that we've recruited over 1,500 additional GPs since October through an investment of £82 million, helping to fix the front door to the NHS. And today we've announced £100 million of funding that will unlock new capacity and more appointments in GP surgeries, and we've also launched a red tape challenge and scrapped unnecessary targets in our new GP contract to cut down on bureaucracy and free up time to spend with patients.
Speaker, my constituents in Hale Zone have written to me time and again complaining that they are calling at 8 a.m. Their GP surgeries as instructed, but they are still unable to get a same-day appointment. So can the Minister set out for my constituents how this £100 million investment in GP surgeries, consulting rooms and other facilities will finally put an end to this frustrating 8 a.m. scramble?
Minister.
Well, I thank him and absolutely share his frustrations and the frustrations of his constituents. The investment that we've made today was in response to GPs telling us that they needed more space, leading to more capacity, leading to better access and better outcomes for his constituencies. Of course, today's announcement was only possible thanks to the decisions made in the October budget, which were opposed by every party opposite. So the choice is clear: investment in our NHS with Labour or cuts with the Tories and reform.
Rebecca Smith.
Thank you, Mr. Speaker. My constituent, Dr. Toby Nelson, an NHS consultant dermatologist, has started a business that seeks to address the heavy demand on primary care for skin health screening. His business, Map My Mole, sends an image capture kit to patients to attach to their smartphones. The patients then send the high-resolution image remotely to be reviewed by a specialist consultant, bypassing the need for a GP appointment and freeing up time and resources for both doctor and patient. It's already resulted in a significant drop in skin cancer referrals in pilot GP surgeries. So will the Minister agree to meet with Dr Nelson and I to discuss this revolutionary proposal?
I thank the Honourable Lady for that question. She raises what sounds like an extremely interesting scheme. She will know that we've got a strong commitment in our 10-year plan to shifting from hospital to community and indeed from analogue to digital, and the digital aspects of what she just said sound very interesting, so I'd certainly be more than happy to take further representations from her.
Number 4, Mr. Speaker.
Minister.
Thank you, and I thank my honourable friend for that question. She is an outstanding campaigner on this issue, as I'm sure everybody across this House is aware. She will know that the NHS England accelerator pilots have shown how improved IT connectivity and a single point of access can speed up eye care referrals and allow more patients to be managed in the community. It's a great example of that shift from analogue to digital that we want to make. We're developing the 10-year health plan with input from the public, from our partners and health staff, and which of course includes the eye care sector.
Thank you, Mr. Speaker, and I thank the Minister for his response. And can I say I welcome all the work both he and the Secretary of State are doing in rebuilding our NHS. But we know that there is a capacity crisis within eye healthcare. NH ophthalmology continues to be the busiest and largest outpatient service. And we know that essentially what's leading to many people are ending up not getting seen soon enough, and which is resulting in many of them losing their sight unnecessarily. So what we need is a joined up healthcare plan. So will the Minister agree to ensuring that eye healthcare will be part of the government's wider 10-year health plan?
Well, I thank her for that question, and she's absolutely right that early intervention is crucial. The interface between the high street and secondary care is a vitally important part of that, and that means having a joined-up eye health strategy. The 10-year plan will absolutely have that joined-up strategy at its heart. She'll be pleased to know that since July, ophthalmology waiting lists have dropped by 24,000. So change has begun. There's still a long way to go to dig us out of the mess left by the party opposite, but it's thanks to the decisions this government's made, opposed by parties opposite, that we're beginning to see that change gaining traction.
So James, lovely.
Thank you, Mr. Speaker. Another part of the 10-year health plan is the use of digital technology. AI auto-contouring reduces waiting times, frees up capacity for radiotherapists, which is why, under the Conservative government, £15.5 million was allocated, money which has now been cut under his government. Why?
Minister.
I think the Honourable Gentleman's referring to the single point of access digital technology, which is game-changing in terms of improving the interface between high street and secondary care, as the question's about eye care. So I probably just worth reminding him of that. We are absolutely committed to single point of access technology. We believe it can be game-changing technology, and it's a vitally important part of our shift from analogue to digital.
Dr. Peter Prince.
Thank you, Mr. Speaker. The President of the Royal College of Ophthalmologists has stated that the widespread outsourcing of NHS cataract surgery to private for-profit providers risks the integrity of hospital eye surgery departments, meaning that there will be few services to treat patients with preventable blindness. So how can we reassure the public that such services will be maintained?
Minister.
Well, I thank him for that question. And whilst the independent sector clearly has an important role to play in tackling waiting lists and backlogs, we will not tolerate any overpriced or subpar care, and we will not tolerate any distortion of patient choice. The recently published partnership agreement between NHS England and the Independent Healthcare Providers Network commits to ending incentives that can lead to this, supporting equal access and genuine choice for all patients, and we're working together to deliver on this.
Yes, Bramford.
Mr. Speaker, NHS Sussex ICB is one of only 5 in England not to commission a minor eye condition service known as MECS in community optometry settings. This means that patients in Chichester with urgent or minor eye issues have to either join the 8 a.m. queue for a GP appointment or go to their hospital rather than being seen quickly on the high street. Given that 99.9% of MECS patients elsewhere in England are seen within 24 hours, will the Minister set out what action he is taking to ensure that MECS are commissioned consistently across all ICBs within the 10-year health plan?
Minister.
Well, I thank her for that question, and of course ICBs are responsible for doing the commissioning of these services, which are clearly extremely important, and the early intervention side of eye care is particularly important. So I'd be more than happy to look into that issue with her particular ICB if she would care perhaps to write to me and make further representations.
Blake Stevenson.
Question number 5, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. Our mission-driven approach to this issue means that we are working with all departments to deliver an NHS fit for the future, and we expect integrated care boards to work closely with their mayors to maximise public health and contribute to the government's health and growth missions.
Blake Stevenson.
I thank the Minister for her response. Funding and delivery of a GP surgery for Wixham's in my constituency continues to fall between the cracks of developers, local councils and the local ICB. Does the Minister agree that to break these kinds of deadlocks and build the infrastructure our communities require, new mayors should have the power to direct ICBs, making locally elected politicians responsible rather than unelected quangos?
Minister.
He tempts me slightly on the local accountability issue, which he may know. I know he has been a strong campaigner on this issue, and he knows, because I've met with him, that I do agree that it is important that these local bodies respond properly to making sure that where there are expansions of housing, which we want to see, that they are supported by local infrastructure. I'm happy to come back to him again if there's any more detail that I can provide to him.
Alice MacDonald.
Thank you very much. Norfolk and Waveney ICB is consulting once again on closing Norwich's walking centre. They asked the same question 2 years ago, and the city and Norfolk said, no, we want to save our walking centre. So does the Minister agree on the importance of walking centres, and how we will ensure in the context of devolution that ICBs actually heed what residents are saying?
Minister.
She's absolutely right to be campaigning on behalf of our local constituents to make sure, as we want to see, that more services are delivered in communities. We want to see services out of hospital into local communities. It is up to the ICB to decide how they're commissioned, but we will certainly be making sure as part of our 10-year plan that we see more of these sorts of services working together in neighbourhoods as part of our commitment.
Natasha Irons.
Question number 6, please, Mr. Speaker.
So stay.
Thank you, Mr. Speaker. People deserve the very best health and care. Our plan for change is already bringing waiting lists down. Our 10-year plan for health will set out how we improve access and make the 3 shifts I described earlier so that the NHS is fit for the future. At the same time, we're rebuilding adult social care now and for the future. Baroness Casey's independent commission has launched, and it will set out through its work how we will create a national care service. All of this made possible thanks to the investment decisions taken by the Chancellor in her budget, investment opposed by the party opposite, showing that you can only trust Labour to invest in and modernise our NHS.
Natasha Irons.
Thank you, Mr. Speaker. Last week, the Centre for Young Lives published a report looking at the state of mental health support for children and young people across England. The report outlines that despite ongoing crisis in mental health amongst young people, there remains a 55% treatment gap between adult and children's mental health, and fewer than 10% of integrated care boards have a dedicated strategy to support children's mental health. So will he consider strengthening statutory guidance for ICBs to ensure they assess the local need of children and young people, publish their treatment gap data on an ongoing basis, and create joined-up, community-based mental health support for our young people?
I'm grateful to my honourable friend for her question. Young people's mental health is a priority for this government. That's why we set out in our manifesto our commitment to make sure mental health support is available in every primary and secondary school in the country. We have walk-in mental health services in every community, and we also invest in the mental health workforce so that we can cut waiting times. I'm also working very closely with my right honourable friend, the Secretary of State for Education, to make sure that our education and health services are working closely together so that children get the very best start in life, and we're looking after mind, body, soul, aspiration and futures.
Sir Roberts.
Thank you, Mr. Speaker. The Chancellor increased the cost of employing people in social care by raising national insurance contributions for social care employers, and then exempted NHS employers from those increased costs. When will this government properly support social care and relieve the sector from pressures caused by the Chancellor under this government?
Mr. Speaker, thanks to the decisions taken by this Chancellor, we're putting £26 billion more into health and social care. Thanks to the decisions taken by this Chancellor, the spending power of local authorities has risen. Thanks to the decisions taken by this Chancellor, we've delivered the biggest expansion of carers allowance since the 1970s. Thanks to the decisions taken by this Chancellor, we've significantly increased the disabled facilities grant, not just last year, but this year. That's the investment delivered by a Labour government, opposed by the Conservatives, and reform, which shows you can only trust Labour with our NHS.
Another chance in a minute. Dr. Luke Evans.
Yeah. This government has been in power for 10 months. 2 months ago, Labour postponed the cross-party talks on social care. Can you tell this House when they will be rescheduled?
Mr. Speaker, as I've announced to the House, the work of Baroness Casey's independent commission is up and running. She's making contact with parties across this House as part of the work of her commission, and it's for Baroness Casey to decide the base upon which she's engaging with parties, and I look forward to working with parties at the conclusion of the process.
Dr. Luke Evans.
Well, thank you for his change for it to be no longer cross-party, but the government has said that the full changes won't be implemented until 2036. Now, only this week, the Health and Social Care Committee released their new report on social care and the huge cost of inaction. The report called for new actions that could be taken now. They include things like publishing annual assessments of the level of unmet care needs for adults, as well as annual estimates into how much delayed discharges are costing the NHS. Will the Secretary of State commit to those two today?
Mr. Speaker, I do take the Select Committee seriously and I'll look carefully at their report. But the Shadow Minister has got some brass neck. He talks about this government being in for 10 months. They had more than 10 years and now we're picking up the pieces for the mess they left behind. That's why they were kicked out of government. That's why they're being kicked out of opposition. Looking at this lot must be how the islanders felt looking at the dodo.
Question number 7, Mr. Speaker.
Minister.
I thank the Honourable Lady for her question. We're already rolling out our manifesto commitment of 700,000 extra urgent dental appointments per year. These appointments are available across the country for those experiencing painful dental issues such as infections, abscesses or cracked or broken teeth. We are committed to reforming the dental contract and making NHS dentistry fit for the future.
Thank you, Mr. Speaker. The dental contract imposed in 2006 is widely recognised as a key factor driving dentists out of the NHS. In my constituency of Stratford-on-Avon, there are no NHS dentists currently taking on new patients, and existing NHS patients are being actively pressured to go private or seek care out of county. Will the Minister commit to urgent reform of NHS dentistry and set out a timeline of negotiations so that I can reassure my constituents?
Minister.
Well, I thank her for that, and she's right that the dental contract is fundamentally flawed and needs reform. I met with the British Dental Association on the 8th of April, had a very productive discussion with them about dental contract reform, and DHSC officials are now working hard with the BDA and other stakeholders to develop a dental contract that works for patients, dental professionals and for the public purse. I will, of course, keep her and the House updated. I know this issue is something of huge importance to the country and to every member of this House.
Chris Webb.
Mr. Speaker, it's been a year today that I was sworn into this House. But every single week someone has raised with me about getting access to a local NHS dentist in Blackpool. Nowhere is taking on adults. Nowhere was looking after pregnant women. This has to change. So can the Minister outline to my constituents when they'll be able to get access to an NHS dentist under this Labour government?
Minister.
Well, I thank him for that, and there is no perfect payment system. We've got to look at the issue around units of dental activity, we've got to look at options around capitation, sessional payments, and come to a conclusion around what works in terms of ensuring that everything that we commit to NHS dentistry is spent on NHS dentistry, because we are in a mad situation now where demand for NHS dentistry is going through the roof, and yet we're having an underspend every year on the contract. So we've got to fix that. It's going to take some time to work that out with the British Dental Association, other key stakeholders. What is tragic about this situation is the party opposite had 14 years to fix this situation and left the situation in a terrible, terrible mess.
Laura Kirkspeth.
Please, Mr. Speaker.
Minister.
Thank you. I commend my honourable friend for her work on such an important topic, and I know it's very personal to her. Specialist perinatal and maternal mental health services are available across England, providing vital support to parents before, during and after pregnancy, including increased access to evidence-based psychological therapies. We are training thousands more midwives to better support women throughout pregnancy, with mother and baby units and community services providing postnatal support.
Laura Kirkspeth.
I thank the Minister for her answer. Tomorrow is World Maternal Mental Health Day, recognising the particular challenges that some mums face in this period from pregnancy through to birth and after birth. I commend the Secretary of State and his team for their rapid work to get the NHS delivering better for patients again. As they develop the 10-year plan for the NHS, can the Minister tell me more about what measures will be taken to ensure that all women, it's not this postcode lottery, but all women facing perinatal mental health challenges can access that right psychological support?
Well, I absolutely join with her in recognising the importance of supporting women's health throughout pregnancy and into parenthood on Maternal Mental Health Day. We are committed to improving the support available. It will form an important part of our 10-year plan. We're investing £126 million in family hubs and Start for Life services to support parents throughout pregnancy to early childhood, and we'll continue to work with her on this.
President Van Baalen.
Thank you, Mr. Speaker, and I thank the honourable member for her question and for the answer from the Minister. I'm delighted to be forming the all-party parliamentary group on fatherhood, and I'd also like the Minister to outline the steps she will be taking to improve perimental health for fathers as well.
Minister.
Well, I congratulate him on taking forward that work, and I know my friend, the Minister, will be very happy to continue to work with him on any way that we can to support the work. I think it's a really important aspect of parenthood.
Katie White.
Thank you, Mr. Speaker. Question number 9.
Minister.
Thank you, Mr. Speaker. We are already using technology to improve preventative healthcare and transform the NHS. We've invested £11 million in AI to trial breast cancer screening mammogram interpretation. We're piloting the NHS Health Check Online to tackle cardiovascular disease. And our NHS Better Health digital products, including the award-winning Couch to 5 app, were used by millions of people last year to tackle preventable conditions, and more will be included in the 10-year health plan.
ATY.
Thank the Minister. Leeds is leading the way in health tech, with Leeds Teaching Hospitals, the City Council, NHS Digital and firms like EMIS headquartered in Rawdon in my constituency, driving real innovation. How will the Secretary of State and his team ensure that Leeds is at the heart of the NHS 10-year plan so we can shift to prevention and spread the benefits to every corner of the UK?
Minister.
Thank you. I commend the work that my honourable friend refers to. The new Health Tech Innovation Hub, a flagship project of the West Yorkshire Investment Zone, brings together West Yorkshire Combined Authority and organisations like the Health Tech Leeds Partnership, academics, clinicians, policymakers, more than 250 health tech firms headquartered in the region, and they are already driving forward health innovation together. And as we've said before, Mr. Speaker, we must learn about the best of the NHS and take it to the rest of the NHS. The 10-year plan will shift to a model where the NHS focuses on prevention, with more services delivered in local communities through new technologies.
Alex Brewer.
Thank you, Mr. Speaker. One piece of technology that already exists that can prevent hydrocephalus is the humble tape measure. The Secretary of State has said he would ask NICE to conduct a review into the frequency of infant head measurements to detect hydrocephalus early. The charity Harry's Hat, based in my constituency, says this review isn't necessary, the evidence is already there. Will the Minister meet with me and the charity to discuss this further so that more infants' lives can be saved?
And in fairness, the Secretary of State did meet with them.
And has just told me, Mr. Speaker, what a wonderful charity they are. And I'll be more than happy to make sure that the relevant Minister meets with you to discuss, meets with the member to discuss that.
Gregory Stafford.
Number 10, Mr. Speaker.
Secretary of State.
Thank you, Mr Speaker. As the Prime Minister and I announced, NHS England will be brought back into the department to put an end to the duplication, waste and inefficiency resulting from two organisations doing the same job. The final nail in the coffin of the disastrous 2012 reorganisation, which led to the longest waiting times, lowest patient satisfaction and most expensive NHS reorganisation in history. Since the announcement, we've set up a joint board, assess resources and responsibilities across existing organisations, develop proposals on the role, functions and structure of the new centre and started detailed operational and legislative planning.
Stafford.
Thank you, Mr Speaker. The Secretary of State claims to support change, yet delays to the NHS reorganisation, including to the promised abolition of NHS England, suggest otherwise. Isn't the truth, as the Secretary of State outlined in his Guardian article, that he's bogging the system down in a slow, top-heavy restructure, while instead resorting to tax rises instead of delivering the decentralised, locally delivered, value-for-money healthcare that our constituents deserve?
Secretary of State.
Yeah, a lot of words and not a lot of sense, Mr Speaker. We are reforming the NHS and, as a result of these changes, redirecting hundreds of millions of pounds to the front line. And what is the Conservative Party's response to the abolition? The Shadow Chancellor of the Duchy of Lancaster said it could be a great thing, but it could be a total disaster. Will you let us know when they've made up their mind?
Anna Dixon.
Thank you, Mr Speaker. I would like to just make the point that the Lansbury reforms, which were implemented top-down by the party opposite, the idea that the NHS could ever be truly independent when it is there to serve us, the taxpayer, the general public. So will the Secretary of State agree with me that it is absolutely the right decision to move funding away from the centre to the front line to prioritise patients in the work that the NHS does?
My honourable friend has huge experience in this area and she is absolutely right. What we saw under the Conservatives was bloated bureaucracy, layer upon layer upon layer of checkers when we need more doers, and that is why frontline staff, patients and provider leaders all welcome the changes we are making so we can invest more into our frontline.
So, Secretary of State, and there you go.
Thank you, Mr Speaker. The Health Service Journal reports officials have acknowledged that the first draft of a high-level plan for merging NHS England and DHSC has now been delayed. When asking any written question about the merger, the standard answer seems to be, and I quote, "Ministers and senior department officials will work with the new transformation team at the top of NHS England, led by Sir Jim Mackey, to determine the structure and requirements needed to support the creation of a new centre for health and care." Even when asking a question specifically about the size of that transformation team itself, the answer is virtually identical. Either they willfully decide not to answer or they simply don't know. As with so many things, the government goes for the headline-grabbing announcement and talks the talk on reform, but without having done the actual work to deliver it. So my question to the Secretary of State is simple. When will that first high-level plan for the merger, with full assessment of costs and savings, be published?
Mr Speaker, honestly, he had his chance. He was the minister who took forward the last Reform Act of the last Conservative government, and he failed in that task. And now he turns up without a shred of remorse, without a shred of humility, attacking this government for cleaning up the mess they left behind. They're not a party of government. They're not even a party of opposition anymore. They are a total irrelevance.
Josh McAllister.
Question 11, Mr Speaker.
Minister.
Thank you, Mr Speaker. We are committed to fixing the front door of the NHS, including delivering the primary care infrastructure required to enable a neighbourhood health service. We've already taken steps to improve primary care infrastructure, including £100 million capital funding to upgrade GP buildings. We will set out how we will move to a neighbourhood health service in our upcoming 10-year plan following the spending review.
Josh McAllister.
Thank the Minister for her answer to that question. Workington suffers from some really poor health outcomes and has an incredibly fragmented health system. I've worked with local leaders in my constituency to pull together a plan for a new neighbourhood health centre called the Workington Health Zone, based around multidisciplinary teams, clear goals and less bureaucracy, and much greater access for patients. Would the Minister agree with me that this is exactly the kind of reform that we need to be enabling through the forthcoming 10-year plan?
Minister.
Thank you, Mr Speaker. I do agree with the honourable member, and I would be delighted to work with him on the government's commitment to deliver a neighbourhood health service which reinforces integrated working for the NHS, local government, social care and wider partners as the norm.
Mr. Back there.
Thank you, Mr Speaker. Knutsford desperately needs a modern medical centre. The local GPs and the community are united that the current provision no longer is fit for purpose, and with the growing population it cannot meet everybody's need. So in light of the government's announcement of £102 million to modernise GP surgeries to make it easier to see more patients, would the Minister meet with me to discuss a new modern medical centre for Knutsford?
Minister.
I thank the honourable member for recognising the significant investment announced today in GP services and buildings, and I'd be delighted to ensure that the relevant minister will meet with her.
Go Snell.
Well, sir.
Minister.
Thank you, Mr Speaker. Driving down waiting times is one of this government's top priorities, and my colleagues at NHS England continue to keep in regular contact with ICBs on improving those waiting times and delivering the ambitions in our elective reform plan. Since July, we've cut waiting lists by more than 219,000 across England and 6,000 in university hospitals in North Midlands, and delivered 3 million more appointments.
Thank you, Mr Speaker, and I thank the Minister for her answer and recognise the Herculean effort the Department is making to reduce waiting times, particularly in Stoke-on-Trent. But one cancer patient who is having their treatment at the Royal Stoke Hospital in my constituency has shared her story with me. From the initial operation, it took 6 weeks for her to be told she may have cancerous cells in the lymph node. There was a delay in the CT scan, and then after the CT scan, she was told it was 10 weeks to meet an oncologist to discuss the results. So could the Minister say a bit more about how, whilst reducing access to the waiting times into the service, once someone's in a treatment plan, how is the Department making sure that treatment is given in a timely fashion?
Minister.
Well, I am sorry for the experience that his constituent has had, and he highlights a really important aspect of the patient journey through the system, and I want him and the House to be absolutely assured that we are looking at that entire patient journey, both into hospitals and between hospitals. We are determined to improve patient experience and the quality of their care and get back that patient satisfaction that was squandered by the last government.
Adam Jones.
Team, Mr Speaker.
Thank
you, Mr Speaker. Reducing hospital backlogs is a key priority for this government's plan for change, as the 18-week standard for elective care has not been met for almost a decade. Our elective reform plan sets out how we return to this standard by the end of this Parliament through a combination of investment and reform. Since July, the waiting list has reduced by over 219,000, and we have delivered an extra 3 million appointments, exceeding our manifesto pledge and doing it earlier than planned.
Yogi.
I'm grateful to the Secretary for his answer and for the progress made, but there is still more to do. My constituent in Newcastle-Lyme has recently been recovering from brain surgery at the Royal Stoke University Hospital. However, she's faced multiple setbacks due to failures in duty of care, including scalding injuries and a severely mishandled admission process. She's now receiving the correct care but had to wait many months to be admitted to the correct ward and has been given limited time for rehabilitative treatment. So does the Secretary agree with me that to tackle backlogs, our hospitals must have the resources they need to provide the right care the first time round, and that patients are given the time and support to fully and effectively recover?
Mr Speaker, I'm grateful to my honourable friend for his question and horrified to hear about his constituents' experience. This is a government that will never brush problems under the carpet, that will never pretend that things are better than they are, and I know that for all the progress we've made in the last 10 months, there is still so much more to do. And when we publish our 10-year plan for health, we've got to make sure that quality and safety are at the heart of every patient interaction. He's right about the need for investment. That's why we're investing £26 billion in the NHS and social care, and why it's so disappointing that the parties opposite voted against it.
On a recent visit to the Royal United Hospital in Bath's breast unit, specialists told me about a red flag system which could help speed up care. If someone has a red flag symptom, like a lump or bleeding nipple, the triage team could book them straight into the breast clinic rather than waiting to see a GP. Would the Secretary of State support an approach like that?
Can I thank the honourable member for an extremely constructive contribution? That is exactly why, at the heart of our plans for reform and modernisation, we're also placing such an emphasis on the digital and technological transformation. We have such rich data about our patients' experiences that we're not using effectively enough. If we use the information more effectively and efficiently, we can spot and identify risk much more proactively and make sure that people get timely access to urgent care and treatment when they need it.
Dr. Britton.
Thank you, Mr. Speaker, and I'm also grateful to the Secretary of State for the work he and his team have done to reduce NHS waiting times month on month for the last 6 months. However, the backlog that grew under the last Conservative government is still impacting my constituents, and I've listened to countless constituents who've told me about the upsetting impact of long waiting times for an ADHD diagnosis for children. This is having a detrimental knock-on impact on access to support, including to CAM services, shared care agreements and lack of support for adopted children. I welcome the news that the waiting lists have gone down, but can the Minister set out how his work will be targeted to bring down waiting lists for an ADHD diagnosis in my constituency to ensure consistency in diagnosis rates across trusts?
Thanks, so grateful to my honourable friend for her question, and I pay tribute to my right honourable friend, the Secretary of State for Education, who's leading work cross-government in this area. We have a task force specifically looking at the issues that she raises, and together we're looking to make sure that our education and our health services are better joined up to meet the needs of young people. I'm also working with my honourable friend, the member for Whitehaven and Workington, to look at how, drawing on his experience, how we can improve the health and care of care-experienced young people and young adults. So I hope we'll have lots of progress to report on these issues.
Thank
you, Mr. Speaker. Of course, one of the ways to reduce the backlogs is to reduce or put an end to health tourism in this country, where people come to this country, get the treatment and then nip back to where they come from. So does the Secretary of State think it's a good idea that people entering this country should provide health insurance or be refused entry?
Mr. Speaker, when any of us travel abroad, we expect to take out travel insurance and pay for our healthcare needs overseas, and that is the standard we expect for visitors to our country too. We've got lots more to do to improve on that front. Can I also say that I deplore the comments made by his party leader, who said he does not support a taxpayer-funded NHS for the British people. He might want that debate. The leader of the so-called opposition says she wants that debate. As far as Labour's concerned, we're clear about where we stand. This will always be, under Labour, a national health service, publicly funded and free at the point of use.
Question 15. Thank you, Mr. Speaker.
Thank you, Mr. Speaker. This government is taking a hard-headed approach to cutting waiting times. We're investing an extra £26 billion in our NHS, and where the independent sector has spare capacity, we will pay to get NHS patients treated faster, free at the point of use. So far, our approach to investment and reform has cut waiting lists by over 200,000. Perhaps the honourable member will tell us how it's going in Scotland.
Logan.
Thank you, Mr. Speaker. The Secretary of State claimed this morning on BBC Radio 4 Today programme, and a most excellent programme it is, that the Labour Party are the only party that can be trusted with the National Health Service. So can he confirm that no aspect of the NHS whatsoever, whether ownership of the estate, provision of specialist services or any other form of privatisation, will be included in the much-promised trade deal between the UK and the United States? No more excuses, Secretary of State. Just give a direct answer to a direct question.
Mr. Speaker, I've said it before and I'll say it again. The NHS will be privatised over my dead body. This party founded the NHS as a publicly funded public service, free at the point of use. We do use the independent sector to cut waiting lists. And guess what? The SNP-led government in Scotland does the same thing. We've also made it clear that the NHS is not up for sale in any trade deal. It is clear, it is unequivocal. He can sling mud as much as he likes. What he can't do is run from the SNP's abysmal record on the NHS of 18 long, poor years.
Right, let us come to the topicals. Yuan Yang.
Question number 1, Mr. Speaker.
Stay.
Straight to the top. Thank you, Mr. Speaker. GPs are at the front door to our NHS. Today, I can announce that we are supporting over 1,000 surgeries across the country to modernise their buildings, backed by over £102 million, the biggest public investment in GP facilities for 5 years. Following years of neglect, this vital funding will create additional space to see more patients, boost productivity, improve patient care, and will enable 8 million more family doctor appointments each year.
Thank you, Mr. Speaker. I very much welcome today's announcement of refurbishing 1,000 GP surgeries across the country, because I've made it my own priority to meet with as many GPs as possible in my own constituency of Earley and Woodley. Our local GPs have been telling me that our health centres need more physical space in order to accommodate growing local needs, as well as to facilitate the expansion of healthcare into the community. So would the Secretary of State be willing to meet with me and my local GPs to discuss how we can better improve the physical space needed for care to be brought close to people's homes?
Thank you, Mr. Speaker. I'd be delighted to do so. Since we came into government, we made this announcement today. We put £889 million into general practice. We've agreed a contract with GPs, including reform for patient access and services. We are fixing the front door to the NHS. Of course, it will take time. We've recruited 1,500 more GPs by the end of March, but day by day, week by week, month by month and year by year, people should see improvements in their GP services thanks to Labour.
Shadow Minister Dr Caroline Johnson.
Thank you, Mr. Speaker. Mr. Speaker, taking medicines on time is important, especially for conditions such as diabetes and epilepsy. Dr Atchison, an A&E consultant who has time-critical medicines for his own Parkinson's disease, understands this well. He's been running a quality improvement programme to ensure time-critical medicines are given on time in A&E. Will the Secretary of State lend this project his support, and will he commit to reviewing how time-critical medicines are delivered on wards as well?
Mr. Speaker, I thank the Shadow Minister for her constructive question. I'd be delighted to hear more about this particular initiative. She's absolutely right about timely access to medicines, and I think through a combination of service reform but also modernisation of technology, we can assist clinicians and patients to help them manage their medication and make sure people get timely access to medicines.
Dr Caroline Johnson.
Thank you, Mr. Speaker, and I thank the Secretary of State for that answer. I'd be delighted to meet with him to discuss it further. Mr. Speaker, unfortunately, when Labour negotiates, Britain loses, and this government capitulated to union demands with nothing in return. It is therefore of no surprise to anyone that within months they're back in dispute with resident doctors, and that the BMA have announced a ballot for strike action. So what is the Secretary of State going to do to protect patients and taxpayers?
Mr. Speaker, I'll tell you what we're not going to do. We're not going to see £1.7 billion wasted on resident doctor strikes. We're not going to see 1.5 million cancelled operations and appointments. That's exactly what happened on their watch. Within 3 weeks, we ended the resident doctor strikes, and we've cut waiting lists by 200,000 as a result. As I've said to resident doctors, they will see their payoff is fair, and that neither staff nor patients want to go back to the bad old days of strikes under the Tories. They had an unwilling and incalcitrant government under the Conservatives, unwilling to work with resident doctors. We want to work with them to deliver better care for patients.
Mr Richard Quidley.
Thank you, Mr Speaker. I would like to pay tribute to my 17-year-old constituent, Arlo Lamby, who tragically died on April the 13th following a diagnosis of a grade 4 brain tumour. I knew Arlo. He was a fun and bright lad and will be sadly missed. Whilst Arlo's parents, Ellie and Alex, wish to put on record their thanks for in their words, incredible and compassionate care Arlo received at St Mary's Hospital on the Isle of Wight, they want to know what steps the Secretary of State is taking to improve NHS access to breakthrough treatments, ensuring that the commercial interests of pharmaceutical companies do not take precedence, so that children like Arlo are given the best possible chance of surviving longer from brain cancer.
Minister.
Thank you, Mr Speaker, and I'd like to add my condolences and heartfelt condolences to Arlo's family. In September, we launched a new series of funding opportunities designed to help increase brain cancer research for both adults and children, and we're committed to furthering our investment and support for high-quality brain tumour research, ensuring funding is used in the most meaningful and impactful way. Honourable members will note that there is a debate due on Thursday on brain tumours, and I'll also be attending the APPG on brain tumours next week.
Helen Morgan, Liberal Democrat spokesperson.
Thank you very much, Mr Speaker. When he gave his statement to the House just after Christmas, the Secretary of State acknowledged that cross-party consensus is essential to delivering meaningful social care reform, and Liberal Democrats support him in that endeavour. But we still don't have a date for those cross-party meetings. Will he give us one now?
Mr Speaker, dates for meetings with the Commission are now a matter for the Independent Commission.
Josh McAllister.
Thank you, Mr Speaker. West Cumbria, like many parts of the UK, is a dental desert, and in some communities, urgent dental access centres have proven a real success at building up dental services. So will the Minister join with me in supporting my campaign to introduce an urgent dental access centre in West Cumbria?
I thank him. The government has, of course, launched the 700,000 urgent dental appointments. I think there's 57,500 allocated to his ICB. He will know, of course, that ICBs are responsible for commissioning primary care services based on the needs of the population. But I also know that he is a very strong campaigner for his constituents. I understand that his dialogue with his ICB on this matter has been positive and constructive, and I'm sure that he will continue to fly the flag.
Sir Jeremy Hunt.
The Chief Executive of the Royal College of Midwives said that the axing of the maternity safety ring-fence pot would, she said, be a wrecking ball to the efforts being made to improve maternity safety. Just a single or a small group of babies spared lifelong disability will more than pay for the cost of this many times over. I know the Secretary of State cares about this deeply, so will he reconsider?
Mr Speaker, the funding is still there, but as many people have urged me, including the Right Honourable Gentleman, we are taking the decision to give more freedom and more flexibility to independent care boards and systems and providers to determine how they can best spend NHS resources on services to improve patient care, safety and outcomes. I think everyone will know that maternity safety is understandably a priority for this government, and of course we expect and will hold the NHS to account to deliver on maternity safety standards.
Olivia Baird.
Thank you, Mr Speaker. Residents in Thiel and across my constituency tell me time and time again how hard it is to get a GP appointment, causing distress and sometimes dangerous delays. Can the Secretary of State outline how his programme of reform and investment will end the 8 a.m. scramble for good and deliver more GP appointments for my constituents?
Minister.
I thank her. She will know that we've hired 1,500 more GPs. That's going to help with access. We've also renegotiated the contract so that there will be online booking systems in every practice in the country, and we've changed the contract to incentivise continuity of care in order to bring back the family doctor. So there's a suite of reforms coupled with investment. I hope that that will deliver for her constituents.
Bob Blackman.
Speaker, one of the great frustrations for medical professionals and patients alike is those patients that have appointments but don't turn up. So what action is the Secretary of State going to take to make sure that actually people that miss appointments are penalised in the system, and so that patients can actually get the treatment they need when they need it?
Thank you, Mr Speaker. We're absolutely convinced that better use of digital tools will enable us to reduce significantly the number of missed appointments and also build in and factor in the likelihood of no-show so that we can reduce waste, eliminate inefficiency. I understand the case he's making for penalties. That's not a route we want to go down until we've made these improvements, and we'll judge how effective they've been then.
Jim Dixon.
Thank you, Mr Speaker. Far too many promises made by the last government that care would move out of hospitals and into the community have turned out to be hollow. I know from speaking to residents in Dartford that hospital and community services have struggled to keep pace with new housing developments in the constituency. In Dartford later this year, I'm pleased to say we're going to see an expansion of our state-of-the-art community diagnostic centre taking care closer to where people live in Dartford. Would the Minister agree with me that this is the start of Labour getting on with finally delivering this big shift? And will he visit Dartford with me to see the centre?
Order, Jim. Come on, I think he got the message in the first stage. If he didn't know it, I'm surprised. Come on, who's answering?
Mr Speaker, he is absolutely right, though, that this is exactly the sort of thing that we are seeing being rolled out across the country and committed to delivering care closer to where his residents live.
Blake Stevenson.
Residents in mid-Bedfordshire are concerned about the standards of maintenance at our two local hospitals. What action is the government taking to support our hospitals in Luton and Bedford catch up on maintenance backlogs?
Thanks to the investment the Chancellor committed to, we are investing in the sorry state of the NHS estate. I'm afraid that is an investment the honourable gentleman voted for, and his constituents will be fuming when they find out who was responsible.
Thank you, Mr. Speaker. Recently I heard from Chelsea, a constituent of mine, who raised concerns over her grandmother Anna's care. After a delayed discharge, she was released with the wrong equipment, which sadly resulted in her falling out of bed and sustaining a further injury. Ensuring patients are discharged in a safe and timely manner is key to continuing the department's significant progress in cutting waiting lists for treatment. So what steps is the Secretary of State taking to promote integrated working between services to support the discharge into the community of patients?
Thank you, Mr. Speaker. I'm extremely sorry to hear of that particular case. It's really important that we do support better and facilitate better discharge. That's why we're reforming the Better Care Fund, looking to integrate better health and social care services through our 10-year plan, and I'd be delighted to hear further from him about what we can do to improve in his area.
Thank you, Mr. Speaker. I have a constituent who has broken and rotting tooth, whose GP referred him to the local dental hospital, but he's been refused treatment as the dental hospital said the surgeon would only take a referral from a dentist, and something my constituent and many others in Somerset just don't have. So what does the Minister suggest he's to do to stop the pain?
Minister. Well, I thank her for that question. She will know that we've now got a commitment to 700,000 more urgent dental appointments. For those who don't have an NHS dentist, they can call 111 and they will be prioritised. We are very clear, every ICB has a target on the 700,000, and if they're not hitting that target, we will want to know why.
Olivia Blake.
It is disappointing to hear from many of my constituents about difficulties accessing diagnosis, medication and other therapeutic inputs and the impact on their lives and livelihoods as a result. Whether it's children or adults, waits of 2, 5, 7 years are becoming the norm. What steps are the government taking to make sure that individuals can use their and exercise their right to choose?
Minister.
I thank her, and I'd like to pay tribute to her for improving support for ADHD and recognising the valuable perspective that she brings through her own lived experience. This government inherited a broken NHS with too many people facing long waits for assessments. NHS England's ADHD task force is looking at how support for people with ADHD can be improved. I look forward to reading their report, and I had a very productive meeting with the director of that task force recently.
Given that the government is committed to 700,000 extra emergency dental appointments, but in the Midlands the UDA rate is just 83% and there's no additional funding for the ICBs, will the Minister give assurance to my Mid-Leicestershire constituents that they will fully deliver on this promise?
I will give him that assurance. We've been very clear that every ICB has a target. That was very transparently published, and we will be monitoring. I'm holding regular meetings with officials to check that every single ICB is on track to hit those targets, and if they're not on track to hit those targets, we will want to know why.
Marcus Campbell-Sabers.
Thank you, Mr. Speaker. Earlier this year, I met with the Cockermouth and Maryport Primary Care Network, who told me about the increasing challenge of supporting my constituents with their mental health. Has the Secretary of State considered relaxation of ours funding rules to allow mental health nurses to be employed wholly by a PCN and not need to be under the employment of a local mental health trust? This flexibility could help GP practices to intervene earlier and reduce referrals to secondary care quickly.
I thank him for that question. We have in fact relaxed the rules on ours so that a mental health worker can be employed in the PCN. He's absolutely right that that's an important part of stepping from hospital to community, but of course there's more that we can do on that, and we continue to do whatever we can to ensure that mental health and GP surgeries are actively integrating.
Robin Swan.
Getting it right first time is a clinician-led programme which leads on improvement and transformation. Can the Secretary of State give reassurance that on any restructuring of NHS England, that getting it right first time, that programme will not just be continued, but it will be expanded and still available to the devolved administrations?
Minister.
I'm absolutely willing to give him that commitment. I know that's something that he has worked on in his previous role in Northern Ireland. It is a programme that's delivering results. We want to see results. We want to take the best to the rest of the NHS and absolutely work together across the United Kingdom to make sure that all our residents across the United Kingdom benefit from the programme.
Gregor Poynton.
Thank you, Mr Speaker. Lung cancer causes more deaths in Scotland than anywhere else in the UK. In England, though, early detection programmes are underway. By 2028, every patient is likely to gain access to screening. In Scotland, though, doctors tell me this programme is a distant dream. Does my right honourable friend agree that SNP is failing Scottish patients, failing Scottish healthcare professionals, and this UK Labour government is getting on with the task of fighting this deadly cancer?
Minister.
I would agree with my honourable friend. We are making great strides in terms of developing our cancer plans. We will be launching a national cancer plan later this year, and the targeted lung cancer screening programme has been particularly effective. The SNP have had a record settlement for Holyrood, and we expect them to deliver. And if they can't, then I'm quite sure that Anna Sauer and Jackie Bailey would be willing to take over.
Thank you, Mr Speaker. Yesterday's report from the Health and Social Care Committee is explicit that we cannot build an NHS fit for the future without effectively reforming social care. Back in January, the Secretary of State promised cross-party talks as well as Baroness Casey's commission. He cannot outsource political leadership to Baroness Casey. Political will is the sticking point with reform of social care. Will he show that leadership? Bring the parties together to find the solutions to unblock this crisis.
Secretary of State.
Mr Speaker, since we came into government, we've already taken action on social care, the investment that we put in, the biggest expansion of carers allowance, the home adaptations through the Disabled Facilities Grant. Now the Commission is up and running, there will be cross-party engagement, but it is an independent Commission and for Baroness Casey to decide how to engage.
Catherine Atkins.
Last week, this Labour government announced the freezing of prescription charges, putting pounds back in the pockets of people in Derby. I visited pharmacies like the Little Over Pharmacy, which provides essential care and support for their communities. But the Conservatives underfunded pharmacies, and across England, over 750 closed between 2021 and 2024. What is the Minister doing to support community pharmacies so we don't lose these vital local services?
I thank her for that question. After years of neglect, this government has agreed with the sector a record uplift to £3.1 billion for 25-26 for this vitally important front door to our NHS. We're also supporting pharmacies to operate more efficiently, including enabling hub and spoke dispensing between all pharmacies later this year, and the legislation for that has been laid, I'm pleased to say. So what a contrast with the previous 14 years. Also very pleased to see that the NPA has withdrawn its view on taking collective action. So we're moving in the right direction, but still a lot more to do.
Alan Miller.
Thank you, Mr Speaker. Welcome today's announcement of the new money for GP surgeries, but in my constituency of Bicester and Woodstock, GPs tell me that they cannot get capital out of the ICB and that the Valuation Office consistently undervalues the cost of rents, making future GP building impossible. Will the Minister agree to meet with me and GPs from my constituency to understand this problem better?
Mr Speaker, thanks to the investment that we've announced, there will be the upgrade to those practices. I advise him to engage with his ICB. We're happy to receive representations if we can help. I would gently point out the investment is only possible thanks to the decisions made by the Chancellor, which he opposed.
Sonia Kumar.
Thank you, Mr Speaker. Ladies Walk NHS Health Centre in Sedgley is a vital hub for my constituents, providing essential services such as phlebotomy and diabetic foot care. However, due to the inaction of the Conservative Council, this much-needed community asset faces closure in 2026, leaving residents without access to critical care. Will my right honourable friend agree with me to discuss urgent steps to safeguard the future of the Ladies Walk Centre and ensure that Sedgley residents continue to receive the NHS services they rely on?
Well, I thank her for that question, and of course pay tribute to the fact that she is in fact a qualified physiotherapist, so she's absolutely right to be talking about the importance of community care. I would be happy to meet with her to discuss the important issue that she raises.
Jim Shannon.
Speaker, what steps will be taken to support more community pharmacies that can offer a broad range of services to those in rural areas to ensure that those most isolated from busy towns still have access to these very important services? Thank you so much.
Well, thank you. And as I mentioned, we've got a record uplift to £3.1 billion. That's a 19% uplift of all the sectors across the NHS. It was actually pharmacy that got the best uplift from the 25-26 settlement. I'm very pleased to confirm. We've also maintained the Pharmacy Access Scheme that provides £19 million to support pharmacies in areas where there are fewer pharmacies, including in rural areas, as the Honourable Gentleman has mentioned.
Tom Trickett.
Well, on pharmacies, they play a key role in communities in rural areas like mine. But when the supply chain breaks down and the pharmacy isn't able to deliver the medicine, clearly it's deeply frustrating. Can the Minister tell us where we are now with the supply chain, and will he thank all of those heroic workers up and down the country doing their very best to deliver these medicines? And finally, will he thank particularly the 400 workers working for Superdrug in my constituency to try to make the supply chain work?
Minister, I'm pleased to congratulate and support the hard work of both the pharmacies at the front line and all the people that are involved in the department and elsewhere to make sure our supply chain is as resilient as possible. I know this is an issue that concerns many members of Parliament and many of our constituents. We are looking to do some sort of event in Parliament, Mr Speaker, to bring the information more closely to all members, but they do a great deal of work. We know it's an important issue, and I will update the House on other measures we're looking to take forward to make sure that them and their constituents are better informed.
Final question, Vicky Slade.
Last month I began receiving concerning emails from the employees of the NHS Trust in my constituency of Mid Dorset and North Poole that their trusts were looking to create a subsidiary company to move staff across into, and they're really worried about their rights for the future. And I know how important it is to you that people have good employment rights. What steps is the Minister taking to ensure fair consultation with staff before creating these subsidiaries and prevent the creation of two-tier employment practices in the NHS where they don't have continuity of service?
Mr Speaker, while I understand the desirability of NHS Trusts for such arrangements, this Government is absolutely clear that staff must be in receipt of good NHS terms and conditions, must feel part of the NHS workforce, part of the NHS family, and I'd be happy to receive further representations from them.
Right, that completes questions. Let the front bench change over. We now come to the statement. Minister of State Dan Jarvis.
With permission, Mr Speaker, I will make a statement on the series of national security-related arrests that took place on Saturday, the 3rd of May. Protecting our national security is the first duty of government, and it is a testament to our world-leading law enforcement and intelligence services that through their tireless commitment, so many plots against the UK have been thwarted. And I want to pay tribute to them again today for the work that they have done, not just this weekend, but in recent weeks and months on these important operations. The two operations that took place across multiple locations this weekend were significant and complex. They were some of the largest counter-state threats and counter-terrorism actions that we have seen in recent times. And I'm sure the whole House will want to join with me in thanking the police, the security services and other partner agencies across the country who showed their professionalism and expertise in carrying out these operations to keep our country safe. Now, honourable and right honourable members will understand that these are complex investigations. The police and the security services need the time and space to be able to pursue those investigations, and our first priority must be to protect the integrity of that work so we do not cut across those investigations and operations at a crucial time. However, these are serious matters and the House will rightly want to remain informed. I will therefore outline as much detail as I am able, and I hope that honourable and right honourable members will understand that there is a strict limit to what I can say at this stage, given investigations are now ongoing. Mr. Speaker, I would first like to outline the facts around the events on Saturday, the 3rd of May. Throughout that day, counter-terrorism police undertook a series of arrests relating to 2 separate investigations. In total, 8 men were arrested by the Metropolitan Police's Counter-Terrorism Command. 5 men were arrested on suspicion of preparation of a terrorist act contrary to Section 5 of the Terrorism Act of 2006 as part of a proactive investigation in the areas of West London, Swindon, Rochdale, Stockport and Manchester. All 5 men are Iranian nationals. Whilst 4 of the individuals remain in police custody, the 5th individual has now been bailed with strict conditions. As part of the investigation, police officers carried out searches at a number of addresses in the Greater Manchester, London and Swindon areas. Investigations continue with searches and activity still underway at multiple addresses across the country. The investigation relates to a suspected plot to target specific premises. Police officers have been in contact with the affected site to make them aware and provide relevant security advice and support. However, the police have also been clear that for reasons of operational security and public safety, they are not, and I am not, able to provide further information on the target at this time. And I would urge members not to speculate on the site. In a separate police investigation, 2 men were arrested at 2 different addresses in northwest London, and 1 man was arrested at an address in West London. All 3 were arrested under the National Security Act of 2023. These 3 men are also Iranian nationals and remain in police custody. I can confirm to the House that these are the first Iranian nationals arrested under the National Security Act. The operations to execute these 8 arrests under both counter-terror and counter-state threat powers in different parts of the country in the space of 24 hours were intensive. They involved a range of different organisations, including different police forces, counter-terror police, the National Crime Agency, and our security and intelligence services. These operations were coordinated through the world-leading Counter-Terrorism Operations Centre, or CTOC, which brings together and coordinates the UK's agencies alongside the agencies of our Five Eyes partners to detect and tackle national security threats. I welcome the work of the previous government to establish CTOC in 2021, which this government has continued to support and invest in since taking office. The significant point about both counter-terrorism and counter-state threats powers is that they allow the police to intervene early to prevent and disrupt threats, not just respond after events have taken place. This is crucial for public safety, but it also makes the investigations more complex, and that is why the police need the time and space to pursue them now. So we will not be providing a running commentary on the work that they are doing. But what now follows is an incredibly complex set of investigations involving hundreds more officers carrying out forensic searches, collecting vital evidence across different sites across the country, and securing witness statements backed up by the continued efforts of our security and intelligence agencies. This is careful, painstaking work. Mr. Speaker, at this stage in the operations and investigations, it would not be appropriate for me to speculate on or comment further on the details of these 2 cases and the motivations behind any of the threats that were posed. But the House will be aware that these operations come against a backdrop of complex, interconnected threats to the UK, where state threats and counter-terrorism, as well as serious and organised crime, are intertwined together. For 20 years, the greatest focus of our national security work was on terrorism, primarily from Islamist terrorism, with additional threats from Northern Ireland-related terrorism and other areas, and those threats have not gone away. 15 terrorist attacks have taken place since 2017, and there have been 43 late-stage disruptions of terrorism plots. But alongside that, we have seen a serious, growing and complex challenge from state threats. Last year, Sir Ken McCallum, the Director General of MI5, said that MI5 state threat investigations had increased by 48% in the previous 12 months. He added that since January 2022, the police and MI5 had responded to 20 Iran-backed plots presenting potentially lethal threats. In March, I told Parliament that the UK is facing a growing and evolving threat from malign activity carried out by a number of states. My statement in March outlined the government's response to the unacceptable threat that we face from the Iranian state and the steps we are taking to ensure that our intelligence and law enforcement agencies have the tools they need to disrupt and degrade Iran's malign activity on UK soil, and we have delivered on the commitments made. I announced that the whole of the Iranian state, including the IRGC and MOIS, would be placed on the enhanced tier of the Foreign Influence Registration Scheme, and I laid the regulations to make this happen in the House on the 1st of April and committed to bring the scheme into force on the 1st of July. I trust that all members will vote in favour when those regulations are debated shortly. Let me be clear. Anyone in the UK who works for the Iranian state must declare it, or they will be committing a serious criminal offence. We will also go after the criminal networks and enablers that Iran used to carry out its work. And the government sanctioned the Foxtrot network last month, a network involved in violence against Jewish and Israeli targets in Europe on behalf of the Iranian regime. Training and guidance on state threats activity is now being offered by counter-terrorism policing to all 45 territorial polices across the UK. And the independent reviewer of terrorism and state threats legislation, Jonathan Hall KC, was asked by the Home Secretary to review the parts of our counter-terrorism framework which could be applied to modern-day state threats such as those from Iran. The Home Secretary specifically asked the reviewer to look at a state threats prescription tool so we are not held back in limitations in applying counter-terrorism legislation to state threats. Jonathan Hall has now completed his review and will publish it shortly, and the government will not hesitate to take action in response to Mr. Hall's advice. As we continue to support the police and the security services in their investigations, I can also tell the House that the Home Secretary has instigated a series of security assessments which are being done or being refreshed in the light of the cases this weekend and the further information surrounding them. This will ensure that the government can respond robustly and comprehensively to any wider national security issues raised by these cases. Mr. Speaker, working alongside our international allies in countering state threats is central to our success. The Foreign Office are engaging with our closest allies to outline the disruptive action that has taken place and will be considering potential future response options as the investigation progresses. The Home Secretary remains in close contact with my right honourable friend, the Foreign Secretary, who I know is committed to doing everything that is necessary to protect the country from these threats and to bring to bear all the diplomatic tools at our disposal. Mr. Speaker, the Home Secretary and Ministers will provide an update on the national security position when we are able to do so, both following these operations and investigations and the wider security assessments that are underway. The government will not hesitate to act in a robust manner to respond to these plots at the appropriate time, but first we must allow the investigations to continue. Our police, security and intelligence agencies are the best in the world and stand ready at all times to take action to keep our country safe. I am sure that they will have the support of the whole House as they continue this vital work. I commend this statement to the House.
Shadow Minister Matt Vickers.
Thank you, Mr. Speaker. I'd like to thank the Minister for providing advance sight of the statement on this critical issue. People will have read the deeply concerning report suggesting that an attack may have been just hours away. This will understandably be worrying to people across the country. This statement reminds us of the tragic incidents that have plagued our country in the past. This month marks 12 years since the death of Lee Rigby on our streets. It also marks 8 years since the horrific Manchester Arena bombing. And later this year will mark the 20th anniversary of the 7/7 attacks, which brought a level of destruction to London that many of us never thought we would see in our lifetimes. These acts of terror, along with other cowardly acts, cause untold hurt to victims and their families. As we discuss the arrests over the past weekend, we must remember the importance of keeping the British public safe from those who seek to terrorise us. I therefore pay tribute to the hard-working members of the police and the intelligence services for their bravery in disrupting terrorist activities. In October, the head of MI5 said that together the police and MI5 had disrupted 43 late-stage attack plots since the Manchester bombing. We must remember that each of these cases is not merely a statistic, but represents someone's life and someone's future. I commend the Minister for recognising the work of the previous government and for acknowledging the measures that we used effectively in this incident. In turn, I know that we'll support measures that enact the National Security Act and give the government the powers needed to act against malign influences on our country. Turning to the incident at hand, I'd be grateful if the Minister could clarify certain points. While I'm thankful for today's statement, I hope the government will, moving forwards, be as transparent as possible about the details to avoid the vacuum of information we've previously discussed in this place. Even though I appreciate that the government does not want to provide a running commentary, I, and I'm sure many other members, would be grateful if it could be as open as possible, given the seriousness of the arrests. As the Minister has outlined, there were 2 separate arrests of Iranian nationals in relation to terror offences. These raised serious questions about how their networks were formed and what their intentions were. Can the Minister provide any further information about the suspects? For example, while we know they were Iranian nationals, what is their immigration status? Was the state aware that these individuals were in the UK? And was there any prior indication of the risk they might pose? In addition, on the broader issue of Iran, while I understand the Minister may not be able to comment on prescription directly, the Home Secretary did address this while in opposition. In July 2023, she told the Royal United Services Institute, instead of trying and failing to use counter-terror legislation to prescribe organisations like Wagner and IRGC, we'll introduce a bespoke prescribing mechanism to address state-sponsored threats. The Home Secretary also said at the dispatch box in April 24 that it wanted appropriately targeted prescription-style restrictions on the operations of state-linked organisations such as IRGC. However, it was only in March this year that the Security Minister announced the review by Jonathan Hall. Does the Minister share my concerns that these mixed signals and the delay suggest a lack of prioritisation from the government? Ultimately, we must all work together to ensure that the UK adopts the strongest possible stance on national security. Cross-party cooperation is essential. I therefore urge the government to take every possible step to prevent these cowardly acts of terror.
Thank you, Mr. Speaker. Can I thank the Shadow Minister for, I think, the very sensible, reasonable and constructive tone of his response. And can I also say to him, he's absolutely right to draw the House's attention to the tragic death of Lee Rigby, the tragic bombing in Manchester, and, of course, the 20th anniversary of the 7/7 bombings that we will be commemorating in a couple of months' time. Let me again join with him in paying tribute to all of those who work tirelessly to keep our country safe. It is one of the greatest privileges of this particular role that we have the opportunity to serve in government, as members opposite will have done also, and work very closely alongside those incredibly committed members of the police and the intelligence services, and I think we owe them a debt of gratitude. I'm also grateful for the opportunity, because he raised it again, to offer our thanks for the work that was done by the previous government, both in terms of the introduction of the National Security Act, which has proved to be an incredibly valuable tool, but also, and I referenced it in my earlier statement, the creation of CTOC, which is delivering very significant operational value. And I can absolutely give an assurance that this government will continue to invest in that institution, as the previous government did as well. I thought he made an important point about transparency, and I can absolutely give him the reassurances that he seeks. He will understand, and the House will understand, that we are just a couple of days on from these arrests taking place on Saturday. The Home Secretary will provide a further update as soon as we are operationally able to do so. And I give him a commitment that we will be as transparent as we possibly can, whilst, of course, ensuring that we do not cut across live counter-terrorism operations. He mentioned prescription, and I understand why he asked the question. I know that he will acknowledge, or at least I hope he will, that on the 4th of March, I announced a very strong suite of measures designed to most effectively address the nature of the threat that we face from Iran. Contained within those measures announced on the 3rd of March was a request from the Home Secretary for Jonathan Hall, who I know is held in very high regard because of the experience, the credibility that he has in this area, to look very carefully at the legislative framework that might enable us to more effectively prescribe state-based entities. I can confirm that Mr Hall has completed his report. The Home Secretary and I are considering it very carefully. It will be published shortly, and I give him an assurance that we won't hesitate to act where there is a requirement to bring forward further measures.
Perinatal.
Minister will be aware that a number of Iranian citizens in this country still have relatives in Iran, and it's not beyond the wit of the Iranian government to use that pressure on them. So in making the requirement to report to our government for citizens of Iran in this country, if they are in any way connected with the Iranian government, how has he taken measures to protect them from exposing their family to the pressure that the Iranian government may put on them?
Thank you, Mr Speaker. I think that the Honourable Member raises a very important point. I can give him the assurances that we seek. The government has been very carefully considering the matter of transnational repression, and we will have more to say about it in the near future. But I can give him an absolute assurance that we have been thinking carefully about these matters. We take them incredibly seriously, and the Home Secretary and I will have more to say in the near future.
Liberal Democrat spokesperson Lisa Smart.
Thank you very much, Mr Speaker, and I want to thank the Minister for advance sight of his statement and for updating the House this afternoon. I also want to add my thanks to the security services and the police for all their work to keep us safe. Over recent years, this House has been called into the Chamber to discuss plots to commit acts of terror on Britain's streets at the hands of the Iranian regime. And yet, consecutive governments are yet to prescribe the Iranian Revolutionary Guard Corps as a terrorist organisation. In opposition, the now Foreign Secretary said himself that the IRGC is behaving like a terrorist organisation and must now be prescribed as such. Earlier this year, I asked the Minister precisely this question. Does the Minister not agree that now is surely the time? In some of his earlier remarks, the Minister mentioned the review that's concluded, and if now isn't the time for prescription, when should the House expect a further update? Further, the Liberal Democrats have welcomed previous sanctions against those linked to the Iranian regime. However, I must urge the government to go a step further and look closely at whether these individuals and others with links to the regime have assets here in the UK. Will the Minister commit to carrying out an audit so that we know where those assets are, enabling the government to freeze them as appropriate? And the Minister is right to reference the long-standing pattern of targeting people of the Jewish faith and of Israeli nationality by the Iranian intelligence service. Could the Minister update the House on any conversations he has had with the UK Jewish community leadership, and specifically the CST, about threats here in the UK?
Thank you, Mr. Speaker. Can I thank the Honourable Lady for, as is always the case, the very sensible and reasonable way in which she's phrased her questions. And let me say to her, I'm always available to discuss these matters in more detail should she wish to do so. She asked about prescription, and I hope that she will acknowledge the response I gave to the Shadow Minister just a few moments ago. We take these matters incredibly seriously. The Home Secretary and I looked at these matters very closely in opposition, and that's precisely why the Home Secretary commissioned Jonathan Hall, and he's the right person to look very carefully at our legislative framework and make recommendations about whether, frankly, we can toughen and strengthen the laws that we have in this particular area. Mr. Hall has now concluded his report. We are looking very closely at it. It will be published shortly, and as I said to the Shadow Minister, we will not hesitate to bring forward further measures as they are required. She made, I thought, an important and helpful point about sanctions and assets. I know that that is a question that will have been heard by Foreign Office Minister, with whom we work incredibly carefully. We work hard to ensure that our response is always as joined up across government as it possibly can be, and the Home Secretary works very closely with the Foreign Secretary, and I work very closely with the Minister on these matters, but we will consider whether there are further measures that need to be taken. Her final point was a very important one about the Jewish community, and I give her and the whole House an absolute commitment that we will work tirelessly to ensure the safety of the Jewish community in our country. The Home Secretary and I and other ministers are in very regular contact with members of that community, including the CST that she referenced, who do an excellent job. I will be meeting them in the very near future, but she can be absolutely reassured that we will work very closely with them to ensure that they not only get the protection that they need and deserve, but the assurances that they will rightly want as well.
Paul Wall.
I'd like to pay tribute to the bravery and the professionalism of the counter-terrorist specialist firearms officers who took part in the arrest of an Iranian national in Rochdale over the weekend. It was indeed a reminder of the constant threat that we face, but also of the intelligence and police services' daily work to keep us all safe. But does the Minister agree with me that in this week of the 80th anniversary of VE Day, it's a reminder too that Britain is at war with a modern enemy, the fascism of Islamist extremism and state-sponsored terrorism? The message should go out loud and clear that my town, our country and this House will never surrender to such terrorism or to its ideology.
Well, the Honourable Member, I think, makes a very powerful and important point, and he's, of course, absolutely right. This government will never drop its guard to the threats that we face, whether that is counter-terrorism, whether that is the specific threat around Islamist extremism, whether that is around the state threats that we undoubtedly face. This government takes these matters incredibly seriously, and we will work to ensure that all of our security services and the police forces have the resources and the tools that they need to address the threats that we face.
Chair of the Select Committee, Dame Karen Bradley.
Thank you, Mr. Speaker. Can I thank the Minister for his statement? No one in this House should be in any doubt about the threat that Iran poses to us and our national security. How confident is he that the designation in the enhanced tier of the Foreign Influence Registration Scheme will be effective? Is he looking to go further?
Well, I'm grateful to the Right Honourable Lady for the work that she does as Chair of the Select Committee. I do believe that FIRS is a very important measure falling out of the National Security Act. It is a measure that we inherited from the previous government. I think it is the right approach, and I think it will deliver significant operational benefit. But we also have to look at these matters in the round, so it doesn't sit on its own in isolation, and it has to be accompanied by a range of other measures, not least the measures that I announced on the 4th of March. But the government will remain flexible and agile, and if we think that there is a need for further action, then we will not hesitate to take it.
Alex Sill.
Thank you.
Mr. Speaker. My committee, the Joint Committee on Human Rights, is currently undertaking an inquiry on transnational repression. We have reams of evidence of Iran oppressing, of taking action against people of Iranian heritage here in the UK. I heard what the Minister said about prescription. I've asked for prescription of the RGC many times, who are certainly one of the bodies in Iran who are responsible for transnational repression. But could he just outline what will happen after the publication of John Hall's review and what the timetable will be, as we are keen to see swift action in this area?
Thank you, Mr. Speaker. Well, let me say to the honourable member that I'm looking forward, if that's the right way to describe it, to giving evidence to his committee in the near future. I can confirm, as I said to the honourable member previously, that this government has done a lot of work looking at the serious but complicated issue of transnational repression. The government will have more to say about this in the near future, and as I say, I look forward to providing more evidence to his committee, but I give him an assurance that we take these matters incredibly seriously. We have progressed at pace the work that we inherited from the previous government. These are not simple matters. These are matters that require a whole system approach. These are matters that we are working carefully across government through the Defending Democracy Task Force. But I give an assurance the Home Secretary and I will have more to say in the near future.
For the House, Sir Edward Lee.
Do we know whether these men entered the country illegally or legally? Obviously, people who enter this country legally are subject to extraordinarily sophisticated surveillance at our airports and ports. Yeah. But people who enter illegally, there is no surveillance at all. It's completely madness that thousands are entering our country with no checks at all. Isn't this a good opportunity to seek a derogation from the Court of Human Rights in Strasbourg and say, because of our national security, we should have the right to detain these people, arrest them and rapidly deport them?
Yeah. Well, I'm grateful to him for the very long-standing experience that he brings to this House. So he will understand, for the reasons that I've already outlined, that there are very strict limitations on what ministers can say at this point, because it would be unforgivable, frankly, to cut across a live counter-terrorism investigation. The police have set out the Iranian nationality of those arrested, and at this particular moment they need the time to pursue various lines of inquiry and investigation. As I hope that he and other honourable members will understand, as a consequence of that, it would be wrong for ministers to provide a running commentary on individuals' details at this stage, because, as members would expect, a wide range of security assessments are underway. The Home Secretary will set out further details at an appropriate moment in due course.
John Pitt.
Thank you, Mr. Speaker. I'd like to thank the Minister for his statement and also join him in thanking the incredible work and dedication of our security services and our police. This is a sobering reminder of the threat posed by the Iranian regime here in the UK and reinforces the need to proscribe Iran's terror army, the IRGC, here in the UK. We continue to hear disturbing reports of charities in the UK being used as vehicles for funding and organisation of terrorism. Will the Minister set out what steps are being taken to stop this organisation, and will he meet with me to discuss these concerns further?
Well, I'm grateful to him for the work that he does in this particular area, and he's absolutely right to make the point, as he does, about the grave threat. I hope that he will have seen the suite of measures that the government brought forward on the 4th of March. These were new measures that will make a very significant difference and will give us an additional resources and capabilities in order to address the threat. I can give him an assurance that we take these matters incredibly seriously. As I mentioned, that there are a series of security assessments that are currently underway. The Home Secretary will report back to the House in due course on those. But of course, I'd be very happy to meet him to discuss these matters further.
Can I thank the Minister for what he said about the work of the previous government and join him in commending the work of our security services and police in keeping us safe. Now, recent events are a reminder of the destabilising role that Iran plays. 20 Iran-backed plots foiled in the UK in just the past few years. This state sponsor of terrorism cannot be allowed to have nuclear weapons. So on that topic, could I urge the government to push our European allies to jointly trigger snapback sanctions this year as part of a comprehensive strategy to put maximum pressure on the Iranian regime?
Can I thank the right honourable gentleman for his question and for the work that he did as Prime Minister. He knows better than most about the extraordinary capabilities that those men and women who serve in our intelligence and police forces have and the commitment that they make to our country. I think he made important points. He's completely right about the number of state-sponsored plots. That is totally unacceptable, and this government, as was the case with the previous government, are absolutely clear that we will do everything that we can to stand against them. He made an important point, I think, about the importance of working closely with our colleagues and partners in Europe and internationally. He's right. That is the approach that we will adopt, and I know that the colleagues in the Foreign Office are thinking very carefully about what more we can do in that area.
McKee.
Thank you very much, Mr. Speaker. Can I thank the Minister for his statement and join him in paying tribute to the security services who keep us all safe. Now, as the Minister will know, the UK is under constant cyber attack from foreign states, including Iran. So can I ask the Minister to update the House on what work the Home Office is doing to protect the UK from ransomware attacks?
Well, I'm very grateful to him because he raises a very important point about cyber attacks, which we face along with countries right around the world. I hope that he will know that the Home Office has recently concluded a consultation on new measures specifically with regard to ransomware. These are world-leading measures that we believe will make a material difference to the nature of the threat that we face. Because essentially what we want to do is smash the business models of those cyber criminals, many of whom operate out of Russia, targeting UK businesses. These measures would be good for our national security, but also good for our economic prosperity. And I can give him an assurance that we are progressing them at pace.
Thank you, Mr. Speaker. I was alarmed to hear that one of these incidents took place in my constituency of Cheadle. It's chilling to think that a regime with such a shocking record of international aggression could have connections into our neighbourhoods. It just so happens I was meeting with the Jewish community in Cheadle this weekend to talk through the issues and concerns that they have. And at this meeting, I heard about how fearful they are of the threat of violence and terrorism from the Iranian regime. So therefore, can I ask the Minister to commit to providing a timeline and producing that report into the IRGC, and also commit into a timeline of when we are finally going to prescribe that organisation?
Well, thank you, Mr. Speaker. Can I thank him for the points that he makes? He's right about the chilling effect of these arrests, and it also underlines the nature of the threat not being specific to any one part of the country. He pressed me on the point that I'd made earlier with regard to prescription. Jonathan Hall, who, as I have said previously from the dispatch box, is someone of great credibility and authority, was asked by the Home Secretary to look carefully at our legislative framework in order to assess whether there are stronger powers that we need in order to be able to prescribe state-backed threats. Mr Hall has worked at pace and has now submitted his report to the Home Secretary and I. The report itself will be published shortly, and as I've said previously, the government will respond in due course, and I know that the Home Secretary will update the House at the earliest available moment.
Thank you, Mr. Speaker. The Security Minister will know that whenever there are reports of hostile acts by Iranian nationals in this country, the Jewish community in Britain have reason to be fearful. So can he update the House on the steps the government is taking to guarantee the safety of Jewish people throughout the UK?
Well, I'm grateful to him for the point that he has made, and I give him a categorical assurance that this government, as was the case with the previous government, will work incredibly closely with the Jewish community to provide them the assurances that they rightly want and deserve. It's completely unacceptable that any sector of our community could be threatened, whether that's by terrorism or by a state-based threat. Home Secretary and I and other ministers are in regular contact with the CST and a range of other organisations from the Jewish community, and we will work tirelessly to ensure that not only are they safe, but that they feel safe.
Sir Julian.
In the fullness of time, it will undoubtedly be revealed what the targets of these terrorist plots were going to be. If it turns out that one of them, again, was the broadcaster Iran International that had to relocate to Washington temporarily in 2023, will the minister undertake to speak with his Foreign Office colleagues about the importance of impressing on the Trump administration that these repressive regimes fear free broadcasting agencies, and that's why the Trump administration should not be closing down Radio Free Europe, Radio Liberty, or indeed Voice of America itself?
Well, the Right Honourable Gentleman, as he always does, makes a very sage point, and he's absolutely right. There is an incredibly important relationship that the UK has with the United States. That is a relationship that we invest significantly in, and we think that that is not only in our national interest, but the national interest of the United States and other Five Eyes partners. I can give him an assurance that the question that he has just raised will be heard by colleagues, and I see the Minister nodding in the Foreign Office, but I'm keen to work closely with him and draw upon his experience in this area, and I agree with the point and the thrust of the direction of the points that he's made.
Chris Vance.
Thank you, Mr. Speaker, and I thank the Minister for coming here with this statement today. And can I also put on my record, and I'm sure the thanks also of the people of Harlow to the police and security services for the work they do, keeping us all safe. In his statement, the Minister made reference to working with allies, and I wonder whether he agrees with me that the conversation he has with our allies, both in Europe and in America, are key to tackling this problem proactively and ensuring that lives are saved.
Well, firstly, can I thank him for the point he made about our police forces, who do a very difficult job, but I think do it incredibly well. And it was deeply impressive to see their work over the course of the weekend. I think he makes an important point about international cooperation. Home Secretary, myself, other ministers, and right across the government completely understand the importance of investing in these relationships with our international allies. These are matters that we are not going to solve unilaterally on our own. We need to cooperate, collaborate with a range of international partners, both in Europe, in North America and further afield. And I can give him an assurance that that will be the approach of this government.
Thank
you, Mr. Speaker, and I too pay tribute to the brilliance of our security forces. The Minister has paid tribute to the quality of advice from Jonathan Hall, KC, the independent reviewer of terrorism, and said that he will indeed listen to that advice. Well, that same Jonathan Hall, KC, last autumn advised that in serious incidences involving terror and these sorts of incidents, it would be better to put out more information sooner in order to prevent misinformation. And in order to prevent misinformation, surely the Minister should tell us and the British people who want to know, how long have these Iranian nationals been in this country and what is their immigration status?
Well, let me say to the Honourable Member that that's precisely why I made the point to the Shadow Minister about the importance of transparency. It's precisely why the government have proactively brought forward a statement to the House today in order to give members the opportunity to ask questions. And it's precisely why earlier on, I gave a commitment that the Home Secretary will come and update the House when we are operationally able to do so. I know that the Honourable Member understands the importance of not cutting across a live police terrorism operation. I hope he will acknowledge that we take these matters incredibly seriously, that we brought forward a range of measures in March that goes a long way towards addressing the nature of the threat that we face. I hope he acknowledges the serious nature with which we always take these matters. But I say to him, I'm very happy to discuss these matters with him outside of this chamber, should he wish to do so.
Jacob Collier.
Thank
Thank you, Madam Deputy Speaker. And can I also pay tribute to our security and intelligence services in foiling what appears to be a highly coordinated plot. And the involvement of Iranian nationals points to a potential state-backed threat. So can the Minister assure me and my constituents that our intelligence and legal frameworks are keeping pace with the growing sophistication of hostile activity on British soil?
Well, I'm grateful to him. I can give him the assurance that our intelligence and legal frameworks have the necessary resource in order to ensure that we are best prepared to face the nature of the threat that undoubtedly we do face. But I can also say to him, the Home Secretary, Prime Minister and ministers across government will not hesitate to act should there be a requirement to bring forward further measures. That is precisely why the Home Secretary asked Mr Hall to look at the legislative framework. That is precisely why we are carefully considering his recommendations. But absolutely, I give an assurance that should there be a need to bring forward further powers, then we will not hesitate to do so.
David Reid.
Thank you, Madam Deputy Speaker. It's clear that the issues that we're seeing from Iran and its proxies are shared across many European countries as well. And the Minister raised the recent government sanctions on the Foxtrot network. However, the EU has just rejected the PM's bid to access the bloc's crime and migration database. Does the Minister see this as an issue and something that will stop us thwarting future threats against Iran and its proxies?
Let me respond to him in this way. As I've said previously, whilst there are certain measures that we could put in place in this country, and of course we will, it is imperative that we cooperate closely with our allies. And the nature of the relationship that we have with our allies in Europe is fundamentally important in this regard. I can give him an assurance that Foreign Office ministers, Foreign Secretary, the Minister, will be looking very closely at what's happened over previous days, talking to our allies and taking every opportunity to ensure that we organise collectively to ensure that those states who think that they can behave in an aggressive way towards this and other countries understand that there will be very severe consequences for their actions.
Dr. Andrew Morrison.
Thank you, Madam Deputy Speaker. Does the Minister agree with me that part of the problem of the Joint Comprehensive Plan of Action that the US withdrew from in 2018 was that it wasn't comprehensive enough, in that it completely ignored the actions of Iran through proxy groups and terror cells? When he and his colleagues are discussing with the US administration the way forward, particularly in relation to the Witkoff talks, will he ensure that terrorism is covered as part of any agreement hatched?
Minister.
Thank you. So I think that's an important point the Right Honourable Gentleman has made. It is one that the Minister and I will consider further, but I can give him an assurance about our understanding and the priority that we attach to the international dynamic to all of this. He will understand, as a former minister, and he's been around a long time, that international relations requires us to work as collaboratively as we possibly can with our partners. We are investing heavily in ensuring that the special relationship that we have continues to deliver for our country and for other Five Eyes partners as well. The points that he has made are well made. We have heard them, we will consider them further, but I assure him we take these matters very seriously and we will work across government to address the issues that he raises.
Gregory Campbell.
Thank you, Madam Deputy Speaker, and I join with the Minister in paying tribute to our security services in their endeavours to keep us all safe. Would the Minister agree with me that the issue of how these suspects get into the United Kingdom in the first place is a crucial issue, and one that has he addressed with the Irish Republic's government regarding people who don't come in here directly but come in under the radar via Dublin and then into Northern Ireland and into mainland GB?
Yeah. Thank you, Madam Deputy Speaker. The Prime Minister has said that border security is national security. So the Honourable Member, I think, makes important points. That is precisely why I confirmed earlier on that as a consequence of recent events, the Home Secretary is looking very carefully, along with other Home Office ministers, at a number of areas. And at the earliest available opportunity, she will come back to this House and provide an update.
John Whittingdale.
5 weeks ago, I visited Iran International at their location in London. They told me that their journalists face daily threats from Iran, as do those who work for the BBC Persian service. Given it's just 3 days after World Press Freedom Day, will the Minister reiterate this government's absolute determination to defend media freedom at home as well as abroad, and will he consider accepting the invitation to visit Iran International to reinforce that message?
Well, I'm very grateful to the Right Honourable Gentleman, who has been a very long-standing champion of both journalism and journalists, and I think he makes some very important points. I know that the Minister on the front bench from the Foreign Office has recently met with BBC Persia journalist colleagues, and between us we'll look very carefully at the invite that the Right Honourable Gentleman has extended. But let me be crystal clear that the threats that we have seen in recent time to Iran International are completely unacceptable. And this government, like the previous government, will do everything to ensure that free speech in this country is not materially affected by those out with the country who would wish to silence others. So we take these matters incredibly seriously. In response to a question earlier on, I said that the government will have more to say about transnational repression in due course, and that very much includes matters such as the ones that the Right Honourable Gentleman has raised.
Dame Harriet Baldwin.
Thank you, Madam Deputy Speaker, and I'm going to try again because I appreciate that the Security Minister has to be very careful about the specific aspects of this case, but I do think the House needs to know and the country needs to know whether the Iranian nationals in this case came into the UK illegally or under a legal migration route.
She's a very experienced member of this House, so I hope she can understand why, as the Security Minister, it would be wrong of me to cut across a live police terrorism investigation. Ministers should not be getting in front of or in the way of ongoing proceedings. And I hope that she will acknowledge the point I made earlier on about the complexity of the ongoing investigations. There are still properties around the country that are being searched by police officers. That is precisely why I've come here today to give a statement and update the House with the information that it is appropriate to update, but I've also given a very clear commitment that at the earliest available opportunity, the Home Secretary will come back to this place and give more details at a moment where it is operationally appropriate to do so.
Me. Oh, sorry, Madam Speaker. Yes, hello there. The Minister says in his statement that these were some of the largest, quote, largest counter-state threats and counter-terrorism actions we have seen in recent times. But if that's the case, I just wondered why the Iranian ambassador has not been summoned to the Foreign Office, and he mentioned liaising with the Foreign Secretary earlier. And on the issue of immigration status, that is not a police or counter-terrorism operational matter. It is a visa issue. So were any of these Iranian nationals dual nationals? Were they here on work visa or student visas? And were those visas issued at post or somewhere else around the world through another embassy or consulate? Previously, we've had incidents in this country where there have been vacuums of information, and when the government have not been prepared to fill that vacuum with truth and facts, others who want to stir up trouble in our nation have filled it instead.
I'm always grateful to him for the experience that he brings to these very important matters, and he's certainly right. This was a very significant operation that required a considerable amount of coordination across the weekend, and as I've explained, it is ongoing. It's very important that I don't in any way prejudice those inquiries, but I understand why he's made the point in the way that he has. I can say to him that there's been very close contact between the Home Secretary and the Foreign Secretary about these matters, And I can also say to him that the Minister from the Foreign Office, currently sat on the front bench, will be meeting with the Iranian ambassador to discuss these matters.
Jim Allister.
If, as the Prime Minister says, border security is national security, how can there be national security if there are no border checks on illegal immigrants at the international frontier between the United Kingdom and the Republic of Ireland? How then do we get security if we fail and refuse to carry out those fundamental checks?
Well, that's precisely why I referenced the Prime Minister's comments about the importance of border security and border security being national security, and precisely why I said that the Home Secretary and the Immigration Minister are looking very carefully at what happened over the weekend, but at other incidences as well. We won't hesitate to act where there is a requirement to do so, and as I've said, the Home Secretary will update the House on these matters further.
Lincoln John.
Thank you, Madam Deputy Speaker, and I thank the Minister for coming here with this statement today. I don't want to probe the out-of-bounds box that the Minister has quite rightly placed around the live investigation, but I therefore have chosen the words of this question very carefully. Does he know the immigration status of the Iranian nationals who were arrested?
I am grateful to him, and I pay tribute to his service in our armed forces before coming to this House. I hope, in part because of that background, he will understand that the one thing that I am not going to do is make things more difficult for those who serve in and out of uniform doing a very difficult job. I can say to him that Home Secretary and I know what we need to know, but we are not going to get into a running commentary. But I've made a very clear commitment that the Home Secretary will come back at the earliest available opportunity and respond to the questions that honourable members wish to put to her. But what we are not going to do is cut across a live police operation. Honourable members opposite and around the House would never rightly forgive us for doing so. We're not going to do it, but we are committed to providing as much information as we possibly can at a point where it does not compromise ongoing operations.
Final question from this statement, Jim Shannon.
Thank you, Madam Deputy Speaker. Can I thank the Minister very much for his wise words, his strong words, his confident words, the words that I think every one of us in this House wishes to have in relation to the investigation. I have, in all my time in this chamber, some 14 coming 15 years, been a supporter of the Iranian diaspora, those who live in the United Kingdom and who fled Iran because of the threats that were made upon them in their lives. Some of them got out by the skin of their teeth. They have genuine fears, they have concerns about what happens, and those concerns have been expressed by some of those who've been Iranian diaspora who've been under some attack in France and Paris is one example, but also in Sweden. During the last election, that Iranian diaspora very kindly offered support to me and my election campaign, and I took advantage of that, as others did as well. What concerns me is those in Northern Ireland who are members of that Iranian diaspora feel threatened as well, just as the ones here do in the mainland. When it comes to offering the support and the protection that they need, that will involve the partnership with the Garda Síochána in the Republic of Ireland to ensure that the threat will not come from just within Northern Ireland, could potentially come from the Republic of Ireland. So can the Minister give me and my constituents and those who are committed to a change of the regime in Iran but who cannot return because the regime is so decadent and so violent and so evil?
Thank you, Madam Deputy Speaker. Well, I'm very grateful to him, as I always am. He's got a very long-standing track record of standing up for those who've been persecuted based on their ethnicity or their religion. And I think he raises a very important point about the Iranian diaspora in this country. That is precisely why this government has progressed an important piece of work on transnational repression. We will work very closely through the Defending Democracy Task Force to ensure that all of the necessary protections are in place for those individuals or communities who feel threatened. My advice to anybody who does feel that they are threatened is that they do need to report that to the police. But it's precisely why I've also recently written to all chief constables right around the country to ensure that the training that is available for frontline officers is being taken up by the police forces right around the country, because it's very important that officers on the beat have the necessary understanding about the nature of the threat that many different diaspora communities might face. So I'm grateful to him for championing not only his constituency but the Iranian diaspora, and I give him the same commitment that I've made to other right honourable and honourable members, that this government will work tirelessly to ensure that they are protected.
That concludes the statement, and I'll give the front benches a few moments to swap over. Order. Before I call the Minister to make his statement, can I say how disappointing it was to see details of the India trade deal released to the media a few hours ago, before the Minister came to this House. Minister Douglas Alexander.
Thank you, Madam Deputy Speaker. I wish to make a statement on the progress this government has made towards a UK-India trade deal. I am delighted to inform the House that we have now concluded negotiations on a comprehensive, modern agreement with the fastest growing economy in the G20. Honourable members will no doubt be aware that India is expected to be the third largest economy in the world by 2028. By the end of this decade, it will be home to an estimated 60 million middle-class consumers. And with trade between the United Kingdom and India already standing north of £43 billion, we know this powerhouse economy is and will remain a hugely important market for British businesses. While past governments have failed to negotiate a deal with India, this government has today succeeded. And we have brokered the most generous trade deal ever agreed by India in its history. From day one of this deal coming into force, it will make trade between our countries cheaper, easier and quicker. UK exports will benefit from much lower tariffs across a whole host of different sectors, including those we are prioritising in our industrial strategy. It means simplified customs processes for businesses in advanced manufacturing, in aerospace, in food and beverages, and in our creative sectors too, which will benefit from improved copyright protection. And for our world-leading financial and professional services companies, this deal locks in access to India's fast-growing market. It will ensure that UK banks and finance companies are placed on an equal footing with Indian suppliers. It also encourages the recognition of professional qualifications so that UK and Indian firms can access the right talent at the right time, whether they are in Mumbai or indeed in Manchester. This deal will unlock new opportunities for businesses in every part of the United Kingdom. Our advanced manufacturing companies in the North East, our iconic Scottish whisky brands, and our car plants in the West Midlands. In all, we will have secured over £400 million in tariff reductions in the first year alone, doubling to around £900 million after just 10 years. Crucially, the deal we've negotiated will also provide bespoke support for SMEs to enter the Indian market alongside a firm commitment from India to address the trade barriers that these businesses face. Since taking office, we committed to hardwiring the views and interests of small businesses into everything we do, and the deal we have negotiated is evidence of that. For the very first time, British businesses will have guaranteed access to India's vast procurement market, covering goods, services and construction. They will be able to bid for approximately 40,000 tenders, worth at least £38 billion a year. The deal that we have just got over the line, Madam Deputy Speaker, is further proof that this government is using the power of international trade and investment to raise living standards here at home. Indeed, experts predict that it will boost our bilateral trade by some £25.5 billion. It is also projected to increase UK wages by £2.2 billion each year, while adding nearly £5 billion to our GDP over the long run. And we have done all of this while defending stoutly the UK's national interest. We've brokered a deal that protects our NHS and upholds our high food standards. It ensures that our points-based immigration system remains unaffected. This deal demonstrates our commitment to both workers and businesses, staying true to our values, to labour values, while contributing to our primary mission of economic growth. Now, I recognise, of course, that this House will need time to scrutinise this deal before the ratification process. My department will follow the process set out in the Constitutional Reform and Governance Act 2010 in sharing the finalised treaty text with honourable members. The House will, of course, have the opportunity to scrutinise any legislation associated with its implementation. Madam Deputy Speaker, this deal defends and sends a powerful message about the UK and India's shared commitment to free, fair and open trade. The UK-India relationship has, of course, deep, enduring roots, exemplified by the living bridge of 1.9 million people of Indian heritage living in the United Kingdom. And while I don't personally lament that the Right Honourable Member for Richmond and North Allerton is no longer the UK's Prime Minister, it would be wholly wrong for me today not to acknowledge his significant achievement as the first British Indian Prime Minister, a testament not just to his own abilities, but a testament to the close bonds that unite our two nations. For this government's part, Madam Deputy Speaker, we are proud to back open markets and free trade. We recognise that Britain has always been an open, outward-looking trading nation, and we believe open markets and free trade are a fundamental building block with which the UK can secure its opportunities and its prosperity at home and abroad. And through our upcoming trade strategy, we will be setting out our ambitions to engage with more industrial giants like India to ramp up trade and investment over the coming months and years. Today, though, as close trading partners and as friends, I am proud that we have secured this deal with India, a deal that affords UK businesses certainty and stability during a time, frankly, of global uncertainty and instability, a deal that will give British businesses access to one of our biggest markets abroad, while raising wages and driving growth here at home. That is what this deal delivers, Madam Deputy Speaker, and I commend this statement to the House.
I call Shadow Minister Dame Harriet Baldwin.
Thank you very much, Madam Deputy Speaker, and I thank the Minister for advance sight of his statement. This deal is indeed a landmark moment for the UK in terms of its global trading relationships, and it is the largest trade deal secured by this country. And I was therefore shocked that the Minister didn't acknowledge that progression of this deal was only possible thanks to our Brexit freedoms. After all, the EU doesn't have a free trade agreement with India, something the Minister must bear in mind as he follows the orders from the Prime Minister on the EU reset. Madam Deputy Speaker, to be clear, we haven't seen the minutiae of the detail in the agreement the government is announcing today. And so to that end, we'll reserve our full judgment on the deal until we've had the opportunity to scrutinise it at length. However, I would like to take this opportunity to highlight some questions. First of all, what concessions did the government make that its predecessor was not willing to make to get the deal over the line? Secondly, I was also shocked, Madam Deputy Speaker, that there's a very significant piece of information left out of the Minister's statement today, which we only found out from the statement from the Indian government. Why did Indian Prime Minister Narendra Modi make a point of announcing an agreement of a double contribution convention between India and the UK, and yet the Minister today has made not even a passing reference to it in his statement or in his press release? A double contribution convention will come at a significant cost to the British taxpayer and to British businesses. It means workers who have entered into the UK under this convention are eligible to only pay national insurance contributions in their home country, in this case, India. Now, we only know again from the press release, Madam Deputy Speaker, that this exemption from national insurance contributions for Indian workers will be for 3 years. Does that mean that Indian workers currently in Britain will get a refund from HMRC? Or does it mean that new Indian workers will not pay any contributions in the first place? Did the Exchequer effectively give away a massive subsidy to get this trade deal over the line? Will it really be 20% cheaper for businesses in the UK to hire Indian workers than British workers? Will this convention only apply to seconded employees of Indian companies, or will it apply more broadly to all Indian workers in the UK, and if so, from when? How many additional work visas will be made under this agreement to Indian workers? And would this convention really mean that an Indian-owned restaurant chain in the UK could pay their chef, for example, no national insurance here, while the British pub next door pays full national insurance for their curry chef? Will this deal reduce the incentive for the Indian millionaires, who are currently a subset of the many millionaires, Madam Deputy Speaker, who are fleeing the UK for tax reasons? Will it reduce the incentive for Indian millionaires to do that? So can the Minister outline what the cost is of this agreement on the Treasury? How many British nationals does the government anticipate making use of these reciprocal rights in India? Because, Madam Deputy Speaker, I fear we have gone from two-tier care to two-tier taxes care for British workers. This government is literally putting up taxes for British workers but cutting them for Indian workers. I'm also aware that India has expressed concerns about the UK becoming a rule taker to the EU. So could the Minister confirm what commitments and assurances he made during the negotiations on that matter? And while we on these benches will never talk down the benefits of free trade, agreements such as this have to be on fair terms for both parties. As it stands, this deal looks like it's subsidising Indian labour while undercutting British workers. Can the government back our domestic market by scrapping its job tax? Now, I look forward to hearing from the Minister in answer to these questions, with a reply that actually answers them. And if he chooses, just as he sometimes does, to bat away genuine questions from the dispatch box, could he follow up in writing? Thank you.
Minister.
Thank you, Madam Deputy Speaker, and can I thank the honourable member for a recognition of this as a landmark deal. Although I have to say it wasn't her most generous welcome of a deal that it's right to recognise the previous government worked for many months to try and secure, albeit they didn't manage to close the most difficult remaining issues. I seem to remember that it was actually a former leader of the Conservative Party, the former member for Whitney, who promised that the Conservative Party would stop banging on about Europe. Alas, that doesn't seem to have been advice that's been taken in relation to the approach to today's landmark agreement with India. She inquired how we got the deal done in relation to what our predecessors failed to do. Respectfully, I would say it was by a process of patient, pragmatic and painstaking work. It was a very different approach than the kind of Instagram diplomacy that all too often characterised the approach of past trade secretaries and trade ministers. That allowed us, with the political leadership shown by the Secretary of State, for example, to close significant chapters on goods and on services. That allowed us to be able to then reach a considered judgment that meant, with stability of political leadership, with clarity of ministerial direction, we were able, frankly, to secure concessions from the Indians and to be able to conclude the agreement in a way that eluded our predecessors. She asked specifically about the Double Contribution Convention. That is, I can assure her, a reciprocal agreement which will benefit UK workers and their employers as the opportunity within India expands. India is going to be one of the world's largest middle classes in the coming decades. The agreement will only cover, I can assure her, a very specific and limited group of Indian business people for a period of 3 years. There are other arrangements in place by the Indians that extend longer than that, it's worth recognising, and the workers will be required to pay their immigration health surcharge to the National Health Service. This therefore does not affect NHS funding. The DCC that we have agreed is reciprocal and will benefit UK workers in India as well, as I've said. India is the home to the fastest growth rate in the G20, so the opportunity here for the United Kingdom is only likely to grow over time. The agreement was of course made in the context of the wider deal, which will bring billions into the UK economy. And I can also assure the Honourable Lady that the United Kingdom already has social security agreements in place with a range of countries and trading blocs, including the European Union and the United States. On the broader issue of immigration that she raises, I can assure her that the deal does not affect the points-based system. The points-based system isn't affected by the agreement that we struck today. The deal only covers business mobility, which is different to immigration as it is about travel for specific and temporary business purposes. And as a result, UK businesses will benefit from additional business mobility routes, supporting them as they expand into India. Student visas, for example, remained off the table. So I hope that gives some clarity to the Honourable Lady. I'm grateful to her for her recognition that the deal is a landmark deal. It's right to recognise that the party opposite sought to secure this deal, and I hope that in the course of the conversations that we will have across this dispatch box today, we'll be able to recognise that this represents a very significant win for the United Kingdom in frankly very challenging times for trade.
Gregor Poynton.
Thank you, Madam Deputy Speaker. The conclusion of the negotiations show that this is a free trade agreement is a major win for Scotland's economy and for Livingston constituency, in particular, given we bottle Glenmorangie whisky and bake Patterson shortbread. We also have a strong and growing digital services sector, particularly SMEs. Can the Minister say a bit more about how this deal will help those businesses too?
Minister.
Well, can I thank my honourable friend and fellow Scottish Member of Parliament. One of the commitments that we made when we were both elected, in my case re-elected to the House back in July, was that we would seek to ensure that there was a Labour government delivering for Scotland. And if you look at the cut that we have secured in terms of whisky tariffs for the huge and significant market in India, it seems to me that's a very clear and tangible example of the difference that we're making. But the honourable gentleman doesn't need to take my word for it. These are the words of Mark Kent, the Chief Executive of the Scotch Whisky Association. The UK-India Free Trade Agreement is a once-in-a-generation deal and a landmark moment for Scotch whisky exports to the world's largest whisky market. It shows that the UK Government is making significant progress towards achieving its growth mission, and the Scotch whisky industry looks forward to working with the UK and Indian governments in the months ahead to implement the deal.
Liberal Democrat spokesperson Clive Jones.
Thank you very much, Madam Deputy Speaker, and I thank the Minister for advance sight of his statement. At a time when Donald Trump is fueling global instability through protectionism, international cooperation is more important than ever. A UK-India trade deal is a positive step, and we look forward to seeing the detail of the deal. Parliament must be able to scrutinise the details carefully, especially the changes to the national insurance contributions that are being proposed. When Labour were in opposition, they agreed with the Liberal Democrats that there should be a vote on trade deals. Both the Right Honourable Gentleman for Kingston and Surbiton and I have made the Lib Dem position very clear. There should be proper scrutiny and a vote on a trade deal. The government's own export minister said that the current ratification process, as it is not fit for purpose. And they're right. Does the minister agree that denying a vote is a contradiction of Labour Party policy, but also sets a dangerous precedent, especially ahead of any future US deal? And can the minister explain the government's massive U-turn since entering government? And finally, will the government push for a new UK-EU customs union, the fastest way to boost our economy, at this month's political summit?
Minister.
Madam Deputy Speaker, let me try and address the various points that the honourable gentleman made. In relation to our attempt to reset our trading relationship with Europe, the red lines that were set out in our manifesto are very clear, but within those red lines we are endeavouring to broaden and deepen an important trading relationship that represents about 46% of the UK's trade. In relation to his broader observation that this is, if you like, a pretty bright shining light, the UK-India agreement that we've reached today, in a somewhat dark sky for international trade, I would agree with him. It is hopefully a sign of further deals to come and a commitment to taking forward the kind of deals that are mutually beneficial, in this case for the Indians and also for the United Kingdom. More broadly, in terms of how this deal will be scrutinised, he's right to recognise that today the Prime Minister's phone call with Prime Minister Modi was just the start of the process. A press release has been published along with the top benefits, but we will be publishing a paper, we hope, today, setting out in more detail what's been agreed, the conclusion summary paper. There will then be a process moving towards signature. There will be a legal scrub of the text. But we will be following the process set out in the Constitutional Reform and Governance Act, and the Prime Minister made that clear himself just a few days ago.
Barry Gardner.
I had the pleasure last week of meeting with the Federation of Indian Chambers of Commerce and Industry when they came with Piyush Goyal, my old friend. And I want to congratulate the Minister, his officials, and indeed FICCI, India Global Forum under the leadership of Manoj Ladwa, everyone who has spent so long, so many years, laying the groundwork for this agreement. The Minister recognised the doubling of India's service and IT exports over the last decade and the benefits that we can get from cooperation on the service and knowledge economy. And I think it's important that he should take further steps to outline just what the benefits will be from the Double Contribution Convention on National Insurance and how they're going to facilitate that engagement and cooperation on services and the knowledge economy for our workers in India.
Well, can I thank the Honourable Friend for his generous words of congratulations, and I know that the bilateral relationship between the United Kingdom and India has been a constant feature of his long service in this House and a particular focus of his parliamentary work. He's right to recognise, both in terms of digital services, more broadly in the services sector, that there are huge potential mutual benefits for the United Kingdom and for India working together. It's right to recognise we have a very broad relationship and deep relationship between our two countries. As I mentioned, we've got the 1.9 million people with Indian heritage living here within the United Kingdom. But it's also, as his question alluded to, right to recognise quite how dynamic the Indian economy is today. It has the highest growth rate in the G20, which is expected to remain above 6% over at least the next 5 years. If you consider that we're a largely services-based economy, notwithstanding our excellence in advanced manufacturing, the opportunities for United Kingdom service exporters, therefore, are huge and growing.
Sir John Whittingdale.
While I welcome the Indian trade deal, will the Minister now switch his attention to the other side of the Atlantic and ask Lord Mandelson to explain to the US administration that tariffs on films is unworkable, impossible to implement, and would do real damage to the film industry, not just in the UK, but also in the USA?
Minister.
So, Madam Deputy Speaker, first of all, let me pay tribute to the Right Honourable Gentleman's long-standing interest in matters related to culture, media and sport and the creative industries more generally. We are grateful for his expertise and experience in the House on these issues. It would be one of the first times I'd told Lord Mandelson to do anything in many decades of working together, but I will make sure that that is duly recorded, not just in the record of this House, but directly to our very distinguished ambassador in Washington. But it's also right to place on record that the film sector is a key part of the UK's world-class creative industries. We are absolutely committed to ensuring that these sectors continue to thrive and create good jobs, and also to recognise that the UK has a strong and balanced trading relationship with the US worth £315 billion. So I'm grateful to his challenge to me to reach out directly to Lord Mandelson on what we've read in the newspapers in the last couple of days. I give him my word, but I'll make sure he's fully aware of the issue.
Tan Singh Desi.
Thank you very much, Madam Deputy Speaker. Amidst much fanfare, as usual, previous Prime Minister Boris Johnson announced that he would have a UK-India trade deal signed by Diwali. But very cunningly, he never mentioned which Diwali. So we were left waiting for years. Other Conservative Prime Ministers made similar such empty promises, and that is why I particularly want to commend the Minister, the Business and Trade Secretary, their officials, and the Labour government for having finally concluded this free trade agreement. And I look forward to this mutually beneficial agreement being formally signed. But can the Minister confirm, will this landmark UK-India FTA lead to an increase in bilateral trade by £26 billion, lead to an increase in UK GDP by £4.8 billion, boost wages by £2 billion year in, year out, and lead to many jobs in my Slough constituency and for others across both nations?
Minister.
Madam Deputy Speaker, he seems to know my brief better than I do. But in all seriousness, it's right to place on record our gratitude not just to the Prime Minister for his sterling work in getting this deal over the line. I would also want to pay very generous tribute to the Business and Trade Secretary, who's done an immense amount of work, and whose visit to India in February with Minister Goyal really unlocked a number of key issues that had proved to be sticking points for the previous administration, and pay generous tribute to the officials of the Department of Business and Trade, both in London and indeed in India, who have worked tirelessly to secure this deal. In relation to its economic significance, I concur with the point that is made in terms of not just India being a huge and dynamic economy, but also it's right to recognise we signed the right deal for the United Kingdom. This is the best deal India has ever agreed to. It is expected to increase bilateral trade by about £25.5 billion and raise UK GDP. But if you like, we managed both to secure a deal more timelessly than was anticipated, and frankly, we got a better deal than many expected.
Then Caroline Dinage.
Thank you very much, Madam Deputy Speaker. The Indian government have said that this deal will mean immense opportunities for talented and skilled Indian youth that will open up in the UK. I wonder if the Minister can please confirm that we have not signed a youth mobility scheme with India before his government have agreed to one with the EU. And can he just clarify one more thing for me? He said we had contribution agreements with the EU and the USA. My understanding is that we've only signed those double contribution conventions with Chile, Japan and South Korea. Could he please clarify?
Minister.
Madam Deputy Speaker, what I said was we have social security agreements with a range of countries, including the EU and the USA. In relation to the position that she asks in relation to whether there is, if you like, a new points-based system being introduced, I can assure her that that is not the case. The deal only covers business mobility, and the UK has not given away visas or created new routes as part of this deal. Existing business mobility routes have been expanded for highly skilled and experienced professionals to cover additional sectors. But to qualify for these routes, professionals must demonstrate they meet the strict criteria for professional experience and qualifications.
Sir Jan Joseph.
Thank you, Madam Deputy Speaker. Does the Minister agree with me that by securing the best deal India has ever agreed, the government has put UK businesses in an incredible position to take advantage of the rapidly growing economy?
Minister.
Thank you, Madam Deputy Speaker. India is quite simply the fastest growing economy in the G20, expected to be the third largest economy in the world by 2028. If you were choosing countries that you would wish to do a deal with, India would be pretty high up that list. By 2030, India will be home to an estimated 60 million middle-class consumers, and indeed many more than that, whose numbers are projected to grow to $250 million by 2050. And by 2035, their demand for imports is on course to top £1.4 trillion.
Alistair Carmichael.
Thank you, Madam Deputy Speaker. For those of us who have Scotch whisky industry interests in our constituency, this is very welcome news. Apparently, globalisation isn't dead after all. But when the Minister speaks about this being a deal that opens doors, what assistance will be given to British companies to ensure that especially SMEs are able to maximise the benefit that they will be able to derive from trading in this very important market?
Minister.
Madam Deputy Speaker, as my statement sought to make clear, there will be specific provision for SMEs as part of this deal, because we recognise the huge Indian market can often be a challenge for businesses that don't have the kind of capabilities of larger businesses. I'm also grateful to the Right Honourable Gentleman for his generous words in relation to the Scotch whisky industry. If you look at the kind of quotes that we're receiving this afternoon from Diageo, from Chivas, from the Scotch Whisky Association, I think he is very much on all fours with the industry in recognising this is a quite extraordinary deal for Scotch whisky.
Thank you, Madam Deputy Speaker, and let me congratulate the Minister in securing this, the UK's largest trade deal with what is the G20's fastest growing economy. The Indian High Commission recently appointed Newcastle's very first Honorary Consul General, and we will have much to discuss when we meet because there is so much in this deal to look at and to scrutinise. And I thank the Minister for specifically mentioning